of each other. So thank you to everyone in this room, and we will be looking forward to what you all issue as a report next year. So again, welcome to Douglas County. Thank you.
Good morning, everyone. Thank you so much.
Thank you very much.
Thank you for welcoming us this morning. My name is Stephanie Kirschner. We don't have a mic in the room, so I'm going to try to speak as loudly as I can and clearly. If you're having trouble in the back hearing me, just give me a high five. I'm with the Farley Health Policy Center, and we're here to facilitate the work of the Behavioral Health Task Force, and I'm so excited to be a part of the work with the task force today. We are already experiencing some minor technical issues, but we do have audio on the Zoom. I wanted to take the moment right up front to welcome those who are joining us by Zoom today and encourage you, if you're having any problems out there in the ether, please use the chat feature in Zoom to contact us in the room. We'll be monitoring that to make sure you can hear us, make sure you're able to participate, and make sure that you're part of the conversation today. If you are having any issues, please mute your phone on your computer or your device. Go ahead and turn off the Zoom video feature. If you could enter your name and organization in the chat for us so that we know you're joining us today. And for small group work later this morning or this afternoon, we'll be breaking you out into virtual work groups on Zoom. And I said multiple times as we were kind of getting ready for this meeting that we're going to ask for a sense of humor related to Zoom and the technology available to us. I think it's a blessing that we're able to encourage task force members who can't be with us to join us by teleconference, but inevitably something's going to glitch. And so if you can be patient with us, keep communicating with us out there wherever you are, and we'll try to be sensitive to making sure you're included. Another thing that should be noted, if by chance you're joining by phone only, this is not on the housekeeping slide, you can *6 to unmute yourself on the phone, and then *6 to mute yourself back. So that's how you can join the meeting if you're not joining us through a laptop. So with that, we wanted to open the day with a video that was made to greet you and get us kicked off and just share the excitement related to getting started with the task force. And thank you, Vince, for helping with all the technology.
Can't wait for today. I'm going to spend it with a whole bunch of people that care about behavioral health and what we can do.
While he's getting that going, one of the other things I can do to just fill up a moment is to welcome the members of the public who have joined us for the meeting today. I think most of you are kind of on the periphery of the room. We're glad that you're here. We want to encourage you to participate in our small group work today. The one thing that won't be happening with the members of the public as we get into the work of the day is we're going to have a little bit of a multi-vote at the end of one of our small group discussions. We're going to ask you to refrain from that, for participating in that. But other than that, we want to hear your voices. We are excited that you're here. A huge turnout. So thank you for coming, and if you have any questions about how to contact us or participate in future meetings, please let us know. We give Vince a minute more and see if we can put this rolling. We tested it this morning. We will move on just to keep us on track. We have a huge day planned. So I can express my excitement that you're all here. And then when we get the video going, we can make sure that the members of the executive committee get to share theirs as well. And with that, I can welcome Michelle Barr. She is here to welcome us, to orient us to work this task force. She is the chair of the task force and also the director at CDHS. So, Michelle, thank you. I know you had a busy morning already. So
That's
thank
all
you
right.
for
I'm
making it time.
excited. When you see the video, you'll see how excited all of us are. So welcome. I'm thrilled to kick off the Behavioral Health Task Force. And I'm thrilled that we have our cabinet members in the room. I get a chance to meet them as the day goes on. And I'm excited for you guys for introductions. So you get to share my excitement for the people. This is an amazing gathering of people. And I'm so proud to be here with all of you. We're here because we need your expertise and your experience and your energy to help us improve our behavioral health system. The system we have today works for some Coloradans, but certainly not all. I think it's fair to say we have a broken system, and we have an opportunity to fix that as a task force. When the governor decided behavioral health would be a priority for his administration, he asked me to lead the effort in this task force. And they need to know the will to make a difference starts at the top. It's kind of rare when the stars align, when we have leadership at all levels asking for reform. This is an opportunity to make a systematic transformation. Not just changes, but a complete overhaul. I will be really disappointed back with just a few incremental changes. I want to see us be revolutionary how we think about behavioral health in our state. Being a little bit better doesn't work for the people who need these services. We can be bold and creative, and we have to be bold and creative to make this happen. I hope each of you feel that you're part of something bigger than yourself and that you're empowered to help change the behavioral health system in the state of Colorado. That being said, we have to be realistic, which is not my forte, but in 364 days, we need to deliver a blueprint. And just to be clear, we will not fix behavioral health in 364 days, but what I do hope we have is a vision for what kind of state we want to be and what kind of behavioral health system we want as a group. And then we can back into it and say, and this is what this looks like in year one, and this is what this looks like in year two. So we're not just creating a vision, but we're also beginning to implement it. And as you know, if we wait till next summer to come up and do a big reveal and here's what we're going to do, we will have missed the opportunity to impact the budget and the legislative for next year. So we need to keep doing things real time. And I hope we have recommendations coming out throughout the year that are actionable. And the answers won't just involve my department. It's going to involve everybody in the room being willing to look at things a little bit differently, whether you're a healthcare provider, a legislator, a consumer, a department. We all need to work together to really reimagine what our system could look like. Most of all, I see us working together to make sure we're thinking about the best interests of the people in Colorado. So it's not about me and what I want or you and what you want. It's really about what the people of Colorado need. And I encourage all of you to put aside any thought you had on, I'm here to advocate for my organization to do more, blah, blah, and really say, how can we advocate for the people of Colorado? And with the Farley Center, I think we have facilitators that are going to hold us accountable for that. So thank you in advance. I'm really grateful for all of you willing to be here, and I know a lot of you took a day off of work to be here, and I'm asking that we continue to get that level of engagement over the next year. This is what's different about this task force and every other task force we could be part of, is the significant engagement that I feel that all of you have stepped up and demonstrated already. I'm going to say this is not, I would be frightened if I were the only leader of the executive committee of the task force, but the governor has appointed 6 people to actually be the leadership of the executive committee. And I will put you, I'm going to introduce you and then I'll put you on the spot. If any of the executive committee members want to make a comment, it would be a great time to do it. We've got Kim Bemstetter, who runs HICPA. We've got Mike Conway, who runs Commissioner of Insurance. We've got Jill Ryan, who's running Public Health. Of course, we have Lieutenant Governor, which we're honored to have here, in Primavera. And the governor also asked us to pick a county representative, and we're thrilled that Barbara Drake agreed to take that role and agreed to host us. So we're hoping to get out to other counties over the course of the task force as well. Please know you can reach out to any of us at any time. morning talking about how excited we are to be a part of the Behavioral Health Task Force. And today's the day. So anybody want to make any additional comments? Go ahead and shoot.
First of all, I'd like to applaud the governor for his executive order, which creates the Behavioral Health Task Force. I think it shows his commitment to making sure that people get the kinds of services they need when they need them. I know when we were both campaigning, we heard from people all across the state about how important behavioral health is and what a shortage there are, especially in rural areas. I chair the commissions of Indian Affairs, and I know we have a member here commission from the tribes, and that's been a huge issue with the tribes as well. So I just want to make sure people know that this isn't the only effort that we're making to improve behavioral health. The legislature did a really great job this year, and I know we have a couple of legislators here, Representative Landgraf and Representative Tracy Kraft-Tharp. They passed some legislation to improve children's mental health, to improve treatment for people who have opioid addictions. And so we worked alongside the legislature, and we want to continue to work alongside the legislature. But once we come with the ideas, we'll be able to do a legislative fix. And then, of course, the governor created the Office of Saving People Money on Health Care. And we know that oftentimes cost is a barrier to getting services. So we want to address that and make sure that people who maybe don't have health insurance, that are underinsured or uninsured, can also get the help that they need from behavioral health. So I'm excited about the work that we're going to do, and the interest has been overwhelming. I think we have over 600 people apply or something.
Yeah, about 500.
So obviously it's a huge issue, and I'm happy to be part of it.
I need to say something, Kim.
No. I just want to encourage all this stuff, scars and experiences, and those in the professional insights to bring all those scars and pain points and turn them into stars and wonderful fuel to help us correct the system and improve the system in a way that all of the pain we went through, maybe it's going to be easier, smoother, and more supportive for others that come after us. And if, every day we challenge ourselves to come into these meetings and take all that pain that each of us has had in our lives, our families' lives, transform it into positive energy that's transformational, a difference maker, that we could really do something enormously special in this commission. And I would also challenge us, just putting on my Medicaid hat and my CHIP hat, that there are so many that are relying on this and on the voice of those 1.4 million that our department represents. Boy, they can't wait for us to every day improve the system. So on behalf of them and behalf of all of our own personal scars, let's really make a difference on this. Michelle, thank you for your leadership.
Sure. Yeah. Just to echo what the Lieutenant Governor said and what Jim said too, I think it's a great move that the governor took to actually establish this task force and the task forces, the working groups underneath. I think he's absolutely right that we all bring to this our own viewpoints and our own scars as we march forward. We've all had family members and friends that have struggled with these issues. This is a fantastic opportunity to speak for those people, those family members, those friends that have struggled with these exact issues. From the tribal standpoint, it is something that I'm working on at the federal level through the NEIC. So this is something that we are involved in a lot of different facets to try and help a lot of places throughout the state, throughout the country. So it's an exciting opportunity. I'm really proud to be here today. Thank you, Michelle, for letting me be here. And thank you for your.
Go ahead and let Barbara speak.
Barbara Drakes. I'm very honored to have been selected to represent counties on this important work. Counties are very, very impacted by mental health and substance abuse issues across many, many different sectors, including service departments, our law enforcement, our jails. If you have any kind of community justice service programs, and of course in our partnership with local school districts. So I'm really honored to be a member of this and hope I bring a good perspective on behalf of the community.
And I'll just finish by saying thank you all. Oh, I'm Jill Ryan, Executive Director of the Department of Public Health and Environment. Really appreciate you all volunteering your time for this issue. Before I came to CDPHE, I was a county commissioner, Eagle County, in a very rural community. And we've just seen our suicides increase like crazy. And one thing I've learned is in a small community, just that ripple effect is just ongoing. And it's really important that we get this right. So I'm so grateful to be a part of this. The governor has tasked CDPHE to really look at the prevention side and make suicide prevention one of the 4 top goals that he's given us. So we're taking a complete reboot of the issue, we're looking at all the data that we have, we're looking at the evidence, we're looking at promising programs in this state, nationally. And so the information that comes out of this group will also really help inform our work.
And I'd also like to acknowledge Summer Gatherful, who you guys will all get to know very well. She left a thriving business when she heard we needed somebody to lead this task force, and she's working alongside of us to make this happen in pretty much record time. So we get to know Summer quite well. So I would just say it's the honor of my career to lead this task force, and I am all in. And I really encourage all of you guys to think a little revolutionary, because incremental is not going to work for us. So thank you and have a great day.
Hi, as we were working through our glitches, I skipped over our objectives for the day. And I just wanted to put these up here to remind us kind of why everybody made the trip. We're going to spend a good portion of the next hour really doing some introductions around the table so that people can really begin to get to know each other, the organizations you represent, and make sure that we're feeling like we're starting to build relationships with the task force. We're going to be spending a lot of time together over the next year, and that will be really important to begin to ground us. We're going to understand better the role of the task force, a historical narrative of how it came to be, and doing some work around as a group determining how we want to work together as the task force digs in this afternoon. And in that digging in, what we're really going to be thinking about is refining and defining a vision for the behavioral health task force that I, as a facilitator, can constantly be driving this task force back to. I think you're probably going to want to kick me in the shin by the end of the year by how many times we'll probably have to do that. There are so many times when we'll want to go off into a tangent. This isn't a tangent because it's not important, but just maybe not what we really need to focus on while we're together in this valuable time today. So we, as a Farley Center team, will be doing a lot of that redirecting along with Summer. And then how are we going to hold ourselves accountable as a task force? And how are we going to define success and be able to measure that along the way? So those are kind of what's on deck for today. With that, just a little intro to the Farley Center. This is the slide that we take with us everywhere we go that kind of crystallizes a lot of the work that we do in Colorado and across the country. But our role today, or our role as a task force, really is to ensure that we can create an environment where this group is prepared when you walk in the door, understanding what to expect, kind of what needs to get done between meetings to make this really valuable time useful and effective for when we are together. I see that as kind of our biggest role. We'll also be a conduit between the subcommittees and this task force. We're going to be with the all 3 of the subcommittees and here. So we'll be able to kind of weave messages back and forth across those different subcommittees and make sure that we're kind of all building in the same direction. We're going to be working really closely with CDHS and the co-chairs of the subcommittees to make sure that that's what's happening. We've already been doing that and developing relationships with them in the last couple of weeks since we hit the ground running, sprinting, which has been actually really fun. So I'm looking forward to continuing to do that. We'll also be responsible for synthesizing the work of the subcommittees into reports and deliverables for CDHS that can then inform the blueprint that this task force is responsible for. So that's us. Jonathan Uther is here. He's with Farley as well, and Shale Long is our director. And I think they'll have an opportunity as we go around to introduce themselves as well. So we're going to take some time. This is a big group. So I'm going to do my first facilitator stab and ask that we be really efficient in our introductions, because I think there's probably about 40 people who are either ex officio or official members of the task force that need a moment to introduce themselves, and we have about an hour. So I'm going to check in on time as we're going through this to make sure that we stay on track, because I think it's more fun to get to the work of why we're here than to make it but I need to introduce themselves. So what I'd like is your name, who you're representing, and what brought you to work at the task force. I think the who you're representing part, Michelle and Summer both, I think, mentioned this already. It's kind of hard. We're all consumers of healthcare. We all have personal experiences in behavioral health. We're all here representing an organization, and those things blur in our work as a task force. But if you don't have to declare the hat you're wearing as you sit here, but if you can kind of start to think about working in the task force with the hat that you really want to be voting with at the end, I think it'll help us as we start to convene more and more to really get a good direction of what is this representing and who are we here to represent. So that's all I'll ask, and we can get started around the room unless there's any questions. Jonathan's really fast.
Yeah. Hi, everybody. Jonathan Muther. Many of you know me from my work at Salute Family Health Centers, local at QHC, and I also get to be part of the Farley Health Policy Center for part of my time. I'm a behavioral health integration advisor. What brings us here is really to hopefully accurately capture the message, accurately capture and convey the energy from this room to provide a cohesive, concise, productive direction. Stephanie otherwise laid out our mission and our work very well. So in the interest of time, I'll move it along.
And just one more little housekeeping. People on the phone can generally hear us okay. The mic is picking up the air conditioning a little bit. So if you can really speak out, use your belly voice so that they can hear you. The green light that's sort of on the up in the ceiling, that's what the mic for the room that's picking us up. And it's going okay, but just speak out, please.
Hi, I'm Raina Gonzalez. I currently work at the Colorado Mental Health Institute in Pueblo. It's an inpatient center. About an hour ago, I just accepted the position to work at the Colorado Mental Health Institute in Fort Logan with the outpatient, the not guilty by reason of insanity gentlemen and ladies. I've been with the state for 15 years, and I'm representing state workers. So I work with Colorado WINS, which is the state union for state workers.
Glenn Most. I'm a clinical psychologist, also the executive director for West Pines Behavioral Health up in Wheat Ridge, Colorado, part of the SCL healthcare system, representing inpatient and outpatient mental health and substance use disorder treatment. What brought me to the work of the task force, I think like the Lieutenant Governor said, this is a great opportunity. And for all the years that I've been at West Pines for 20 years, before that, worked at Aurora Mental Health, Fort Logan, the VA, haven't seen momentum that we've seen the last several years in behavioral health. And I think this is just great. And to see this wide variety of experiences and backgrounds here at the table, I'm very excited about the course of the coming year. Thank you.
My name is Nancy Ingalls, and I'm the Personalized Learning Officer in Douglas County School District. I oversee mental health, special education, early childhood education, and health, wellness, and prevention there in the school district. So I'm here representing K-12 education. And what brought me to the task force is throughout my career, I have experience not only in public school districts, but also in behavioral health and residential treatment, and also working for juvenile justice.
Good afternoon. My name is Selwyn Whiteskunk, and I'm from the Ute Mountain Ute tribe. I'm representing the Ute Mountain Ute tribe and tribal entities that serve the Southern Ute tribe as well as the urban Indians. It's an exciting time for tribes here in the state of Colorado. I look forward to working with the task force and giving the information that we compile, directives, and what ongoing work will be conducted to address the American Indian concerns and matters. What brought me to this workshop or to this task force is a huge need in our Indian communities that go unnoticed, even for our tribal governments as well. It's a unique system that the Ute Mountain Ute tribes and all tribes and urban Indians have. Is we have different services, whether it's sector. It's so easy to get the monies and the funding, but to initiate a comprehensive program to meet the needs of our people in these communities is so critical. So it's exciting for me to be here today to learn as much as I can, as well as have input in looking at issues that are plaguing the American Indian communities in the state of Colorado. So again, I've obtained a master's degree in public health administration. I've been with the tribe for three terms, 9 years, three terms, 3-year terms as the chairman of the tribe, 1 term and as a regular council member official for the tribe. So I've taken a 10-year leave, but at the encouragement of our tribal members, they brought me back here. So I'm looking more forward to this endeavor that the governor and lieutenant governor and others put together, and as well as the state departments and the people that are just here. I get to know you, work with you, and pass this on to my staffs that work with me, that I represent as well. So I thank you guys for, and the Lieutenant Governor for the task force to allow me to sit here before you. Thank you.
Good afternoon. My name is Nancy Vandermark, and I work for Mental Health Colorado. So we advocate for people with mental health and substance use conditions to improve both health promotion, mental health promotion, as well as access to treatment and reducing stigma. For me, I've been around the field of substance use and mental health for 40-ish years, and as a provider, as a researcher, as a state agency employee, and now with an advocacy organization. And I believe that at this point, the thing that grounds me in these discussions are the stories that we hear from people every day at Mental Health Colorado about where they struggle to access the services they need, and that for me is the grounding point for this work, because although there are many places where the systems work well for people, we tend to hear the stories from the places where they aren't working, and so it just seems like for me that's the grounding, is how do we improve those systems so that families don't struggle anymore, and that people can get access to the things that they need when they need them, like any other health condition, or actually better than any other health condition.
My name is Laura Teachout, and gosh, my background is really different from what I'm hearing. I have a law degree from Boulder and worked in IT, enterprise IT for IBM and University of North Carolina at Chapel Hill for years. I'm on the board of the Colorado Springs affiliate of NAMI, the National Alliance on Mental Illness, and we do advocacy and education and support for people living with mental illness and for their family and their friends. And I came to that board as a person with lived experience. I've coped with treatment-resistant depression and PTSD for more than 25 years, and I'm happy to be here representing folks who struggle with mental illness. I've also been involved with a grant for a Department of Transportation grant for getting transportation for people dealing with mental illness, and I'm happy to say we won a $250,000 grant to support these folks in Teller County.
My name is Debbie Olsenettle, and I'm the Deputy Director for the Division of Criminal Justice of the state. So I'm representing Stan Hilke with the Colorado Department of Public Safety. Prior to this position, I was the Director of Brookfield Health and Human Services, where we really wanted to do the no wrong door approach. And because we were a mid-sized county, I was able to oversee all of the human services side of things, public health. We worked a lot on trying to break the stigma down, so on and so forth. I could go on, but saw people enter our system through so many different ways. Long time ago, I was worked for the Office of GDC. And it's just so interesting to me because even back then, it was the same discussions. I worked on some projects related to community and juvenile assessment centers. So it's just very interesting to me to see this kind of come full cycle. On a personal note, I have a passion for it because 2 of my children suffer from autism, high functioning, but essentially is a variety of mental health issues. And so I'll just say as a professional, knowing the system, still struggling to navigate the system, and yet having the resources to do so, and a passion for those who aren't able to do that, might not have the education, the financial needs, and would just am honored to be on this committee for a variety of reasons.
I'm Neil Epperson. I'm the Robert Friedman Professor and Chair of the Department of Psychiatry at CU Anschutz. As in that role, I represent faculty and staff on the campus, but also at, we have many faculty at the State Psychiatric Institute in Pueblo, Fort Logan, the Department of Corrections, faculty that are at the hospitals on campus, as well as Denver Health and the VA. These are a number of people who have committed their life trying to understand the causes and how best to treat psychiatric illnesses. I'm a fellow Tar Heel, coming from UNC Chapel Hill, where I was trained in medical school to believe in the public health mission. As of July 4th, this will be my 10th month in the position, so I'm a newbie to the state. And actually, in some ways, I think that might be helpful because I come to the state with a different lens, having lived in North Carolina, worked there, Connecticut, as well as Pennsylvania most recently, and trying to really help people have access to mental health care. It is my pet peeve that we cannot provide adequate access to mental health, even if you do have insurance, because we know that there are phantom networks out there and people who are suffering from mental illness are not in a position to call 100 people to find somebody who can see them in a week. And so if anything, that's something that is really, I'm excited to help and hopeful that we're going to be able to make some inroads here. So thank you for asking me to be involved.
Yeah, again. Okay. All right. Well, I'm still Barbara Drake. So for those of you who don't know me, prior to becoming the deputy county manager for Douglas County, which I've been doing for about 6 years, I have about 35 years experience in human services. Was the director in El Paso County, retired from that, and came up to be the director in Douglas County before. So I like to say I'm a recovering human services director. I'm starting to change. Social work is my educational background, and I would just like to say, as we've seen here, and as I believe in, all get and believe, if we all get together and really talk about what does it look like when it works for the people that we're serving, that we can get there and get barriers and the red tape and the reasons why it doesn't work. So I'm big about what you call getting to yes and working with willing partners to figure out how we help people get access. I feel very confident that we can do that together.
Prior to being lieutenant governor, I was, my profession was a vocational rehabilitation counselor. So I worked with people with disabilities to try and help them find work for over a dozen years. And some of the people that were the hardest for me to find work for were people that were mentally ill, not only because of their illness, but because employers really didn't want to hire someone who was mentally ill, part of the stigma. In that capacity too, I also saw lots of people with disabilities that had co-occurring disabilities, brain injuries and IDD, and also couldn't access behavioral health services because nobody knew how to deal with their specific injury. So I want to make sure people don't fall through the cracks that really need it, regardless of what their other co-occurring disability is. And then I also had a brother who was mentally ill. And if he'd had the kinds of services that he needed with his mental illness, he probably would have been here today with us. So it's personal for me as a family member as well as my prior profession. So I'm just really excited for us to be able to just kind of think outside the box, what other kinds of things can we do to help people succeed in life? when they have a mental health. I'm Michelle Barnes. You've already heard from me, so I'll cede my time to the rest of the group.
I'll do the same.
I'll do the same. Hi, I'm Nancy Jackson, Rappaport County Commissioner. Just by the way, I get a smaller name tag because I'm actually co-chairing with Robert Worthline, the Safety Net Task Force. So I'm actually not a member of this committee, but we will be coming to you with reports. So that's our job. So it's good for us to be here. I'll just tell you briefly. In my role as county commissioner, I do a lot of things. So I serve on the CCJJ, our Colorado Commission on Juvenile and Criminal Justice. It's always wrong. I'm also chair of the Rocky Mountain Crisis Partners board. Glenn's on that board with me. And as well as serving on the community mental health board. So I serve and represent a whole host of different kinds of levels of government, which is what and my reason for being here, other than personal and so on, is I'll just say real quickly, I got started when I was putting myself through school way back in the late 60s, working at a place called Mount Airy, Denver. If anybody that place. It was quite an education for a kid. So I've been interested in mental health ever since. And now I'm really interested in linking, making links. So we've talked about access, but there's so many systems and there's actually a lot of people doing some good things, but we need to either, we can call it building bridges, we can call it linking. But as Barbara said, we need to get together and talk and put some bridges over those. It's more metaphor, but anyway, forge those links, build bridges over chasms, whatever metaphor you want. And I'm quite passionate about it. So I'll stop talking or else I'll talk forever.
Brian Turner. I work for Sol Vista Health, and we are a community mental health center. We cover Fremont County, Chaffee County, Lake County, and Custer County. So mental health, substance use treatment. We also operate a integrated behavioral health and primary care clinic in Canyon City. So I think that I'm here representing Sol Vista, but I'm also representing mental health centers. And I think most importantly, probably representing rural in a big way, which is somewhat odd because I've been rural for exactly 1 year. I was born and raised in Denver, moved down there. But my community, when they found out that I was going to be in this role, I'm sure I knew you are representing rural and frontiers. Also representing, I made a commitment. We started a member advisory council shortly after I started there a year ago. And these are the folks that we serve. We have representatives from NAMI Southeast and NAMI High Country there. A lot of the people that we serve every day. And I made a commitment to them as well that I'm here representing their voice. So that's really what I'm here to do. I'm a public health guy who somehow works in community mental health after a lot of years with a corporate finance background. So I don't know how I got here, but I'm here. And I'm grateful to be here.
I'm Jen Fanning. I'm the executive director for the Grand County Rural Health Network. We're a health alliance up in Grand County, Winter Park, Granby general area. I represent Grand Jackson counties is where we do our work, but also I serve on the board of the Northwest Colorado Community Health Partnership, another health alliance for the entire Northwest region. So I feel like with all the work that we do, not only with healthcare, care coordination, mental health navigation, across the board, I have a really good understanding of those 5 counties. We work, I specifically have been in this role for over almost 12 years now. And we work with over 50 partners, healthcare providers, primary and mental health. So I have an understanding of what they really experience in the rural community, human services across the board, nonprofit, government, school, et cetera. And most importantly, the people. And we have very different levels of work within each. And recently we've really been working to lift up the voices of the people through an equity lens, because it's so important. And so often we sit around thinking of ways to make change without talking talking to the people who actually really truly experience the system, and then it backfires. So that's what I'm here to do, is really hopefully represent rural. You'll hear me talk a lot about rural, because things look differently in rural, very much so. And one of the biggest, also everybody in my family has experienced some level of mental health, both my nuclear family that I have created, as well as the one in which I came from. Personally, seeing the care coordinators and the healthcare providers and everybody in my community when they need something to support themselves in order to give care to the people, there's nobody to see them because of the ethics related that mental health providers do a very good job holding to. So we're stuck out there not getting anything. And that's something that thankfully telehealth is coming. But that's something that I'm very, very passionate about, also making sure that the people who are providing the care are also able to take care of themselves so they can continue to thrive.
My name is Byron Pelton. I'm a Logan County Commissioner. Same stuff that Commissioner Jackson does down there too. So I wear many hats. But one of the things that I do is I'm also the president of the Colorado County's Eastern District. And if you can imagine, if you take you from I-70, if you go just a little bit south of I-70 and go all the way to the Nebraska border into Weld County, that's the Eastern District. So right in there is the Eastern District. And according to the Substance Abuse and Mental Health Service Administration, we are the worst for both mental health and substance abuse treatment in the state. So that is why I am here, to represent rural Colorado and really my region of the state, because it is one of the toughest. Director Barnes knows. I've shown her several maps.
I spent Friday afternoon with your colleagues.
Okay. Our directors.
Your directors, they were passionate about mental health.
Yes, and I also sit on the Northeastern Colorado Health Department Board as well, and we see a lot of issues from there. I also come from a personal standpoint where I've lost many friends to suicide and mental health, and then recently 2 years ago we lost my brother to substance abuse. So same thing, he would still be here today if there was some mental health treatment for him, and then we wouldn't have had to. He would still be here today. So that's what I'm here.
Michael, if I could request a booming voice from you, I think the people are having the hardest time hearing people who are on the same row as you. So even clean and booming. Stand up. Or stand up.
Oh, I'll try booming first. So my name is Michael Fields. I am the Executive Director of Colorado Rising Action. I'm a former teacher. So I taught 4th grade, 6th grade. Obviously, this is an important issue for everybody, but especially our young people. I'm excited to work with you all, try to figure out how to improve our behavioral health system. How do we go from 43rd to the top 5? And I think we can do it. I wanted to thank the governor and lieutenant governor for bringing us together. And I'm excited to learn from you all. You guys are so smart and impressive. So I'm just glad to be here.
I'm Jill Dario, and I'm the Executive Director of Mesa Youth Services. I'm out of Grand Junction, so I'm here representing the Western Slope. And although we are 100,000 people in our area, we're still rural, and we're still, people who live in Denver think, oh, they're in Utah. So we want to bring a voice to the Western Slope, and also talk about the lack of services and the shortage of help. When someone is in crisis and living 10 minutes to 10 minutes, and they're told they have to wait 6 weeks to see someone for help, that's not okay. And so I'm also talking about from a consumer side, but then also representing the youth of Mesa County. We serve about 1,000 kids every year, ranging in ages from 7 to young adults age 24. We provide a variety of services, mentoring, employment readiness, kids who've been in the criminal justice system. So a wide variety of kids for a wide variety of ages, and I'm excited to work with all of you. So thank you.
I'm Tracy Kraft. I'm a state legislator in my 4th term. Representing Arvada, Westminster. I come here through a long, diverse path around in the mental health field. I was a psychotherapist. For adolescents in Jefferson County. And I worked for the state on several federal granted programs, 2 system of care projects, and early childhood mental health, providing mental health consultations in child care centers. And then, so I come from a lot of hands-on experience, and now I'm really focused around the policy. I try to do at least one mental health, behavioral health bill every year. I probably represent, and then I sit on the Juvenile Justice Delinquency Prevention Council. I probably represent the devil's advocate point of view. I've served on probably just about every one of these task forces that we've had in the last number of years. And I guess one of the things I want to point out is I think everybody has a really relevant point of view around the gaps and the needs we have in our services, in our system. I also want to point out that we have one of the most creative, innovative services here in Colorado. We have, have really piloted our crisis system, which we're moving into point 2, which is really top notch. I don't know if we received awards, Robert. So I just want to make that point also, that we've got some really creative, innovative work here at the same time while we are looking at the gaps and the needs of what we're doing.
State Representative Lois Landgraf. I represent Southern El Paso County, which includes Fort Carson. So I have a large number of veterans. I have absolutely no experience with mental health, work experience, that is. But I was the sponsor of the 3 bills that you were asked to read. I will admit I had to go back and read them myself today. And I am working on starting a veterans integrated services, which would include mental health and transitional housing compound in the Fountain Valley. And it's being very well received, and we are moving forward. And I'm really excited about that. And that's outside of the legislature, although it may end up being inside this next year. We'll see.
I'm Mickey Hunt. I'm the Deputy Executive Director for the Department of Military and Veterans Affairs. Before that, I was 30 years in the military. I'm a retired Chief Master Sergeant, and I had 2 tours of combat in Iraq during that time, so I understand a little bit of what the soldiers and airmen go through. Been in this job 10 years, and obviously I'm here for veterans and military. During my time, I got appointed to 2 different Governor's Challenge SAMHSA teams. And we went to SAMHSA training in DC and Baltimore. The first in 2015 resulted in an opportunity to take an armory in Grand Junction and turn it into an old one that had been moved out of, and refurbish it and turn it into a Veterans One source for families and military members. And their families, veterans, and their military members, so that we're partnering with the community out there. It just opened in May, and where our vision is that any person can walk in and get any service they want. The VA hospitals combined with us on that, and they're hoping to rent space too. And then earlier, another SAMHSA team that was with veterans suicide. And so both of them does a lot of outreach to the state. And so that's a little bit of the background I have. With that, I don't have any social work or other type of professional training that way.
Good afternoon, everyone. I'm Daniel Darding. I'm the CEO of Signal Behavioral Health Network, and Signal is a managed service organization that has been for a couple of decades, provisioning safety net substance use services for a variety of regions in our state. And since today is July 1, we are also a partner with the state, with the Office of Behavioral Health and provisioning and working in the crisis services realm as well. And we're really excited about this new opportunity to work together in this way. You know, I thought a lot about sort of the perspective of what it means to be a part of this group. Number one, I feel there is such incredible expertise and knowledge in this room, experience. I too have an IT background, so Laura, I really appreciate knowing that we're together on this. And You know, I've been a part of Signal for over 10 years now, and the CEO for a little over 4. And you know, I think very sincerely, I would say that my desire is to be present in learning and hearing. I think a lot of the challenges that we face together are ultimately rooted sometimes in not simply knowing things and knowing pieces and not having a full perspective. I think there is a lot of opportunity to focus on what is working, and also that leads us to what isn't working as well. And then Director Barnes, your comment about being prepared for revolutionary change that relates to those things that aren't working, I think that's something that I want to be a part of helping to partner on. But I think it really starts from that premise of being engaged in this. And I am really I'm very, very privileged to be a part of this group and hope that I can contribute in a productive way.
I'm Meg Taylor with Rocky Mountain Health Plans. Also just recently started crisis services. You might have seen us on the news in the past couple of days. So I am representing both the Ray from Medicaid and also CHIP, and with the primary focus on how do we solve for access to behavioral health services. I think that we need to look at what qualifies as access as well as what it really means to access care. I think that we have major gaps in that. I think we have a time now and a place to be responsibly disruptive to what's not working, and then also raise up what is working. Professionally, I've done direct clinical treatment. I worked in child welfare with death. I've worked in behavioral health integration for several years, and now have the opportunity to lead services for Medicaid members and all individuals in our region that need crisis services. So again, I do not think, I would echo what you said, a person should not have to call and get a list of 100 providers and hope that 2 call back. I think it's been broken for a very long time. I've worked for another major health plan and it was a problem. And so people that identify as a need or identifying someone in need, we should be able to get them access to services immediately and not have a wait and not say that this counts as access, even if we offer them an appointment. So I just think that we have a real chance to work as a group in doing that.
Hello, everyone. My name is Shale Wong. And as Stephanie introduced me earlier, I direct the Farley Health Policy Center. So I can't say strongly enough how privileged we feel to be able to be facilitating this work and to really dig in with you all. We've had some opportunity to do this sort of facilitation and convenings for behavioral health integration and behavioral health policy in a variety of states across the country. And so to be able to do it at home and to learn from all of you is so incredibly meaningful. I'm a pediatrician by training, and so while I don't have behavioral health training, I've been doing behavioral health for 25 years. And what I guess I feel most about this and what is most exciting to me is that it really takes not just a village. I mean, it takes more than the village. It takes everybody coming to the table and the understanding of what the real stories are and how that can begin to inform and improve the systems that we all need to work in. So while we can say, that we try to inform and study health policy, it's most meaningful when you can be in the room, when you can talk to people, when you can hear the stories, when you can learn from the professionals, the people on the ground. And so this is incredibly meaningful work. And so I thank you for allowing us to be here.
Hi, I'm Valerie Schlecht. I'm here representing the Colorado Cross Disability Coalition. We advocate for social justice for people with all types of disabilities. I'm the lead on behavioral health policy.
Hi, everybody. I'm Dean Williams. I'm the executive director for the Department of Corrections. I'm one of the ex officio members, and I asked specifically that I get appointed, and I may not be able to make every meeting. I wanted to hit this out of the gate and express the importance of this whole area for a whole bunch of reasons some of you may already know about, but one, and I hate to say this fact because it sort of says, well, that's just kind of the way it is, and it's not the way it should be. But many of my business and my colleagues around the country say, well, you know, our organization is the biggest deliverer of mental health services in any state. When you think about any state in the nation, and every one of my colleagues will say the same thing. That's a problem. And a lot of my colleagues around the state, we all say it's a problem, but we really don't know where to go once we make that statement. I was struck by the fact that in the governor's opening letter, he says we're spending about $1 billion in state monies on mental health services. And guess what? My budget is approaching. It's about $1 billion, 900-some million dollars. And I used to run Alaska for 3 years before I came here. I have family that my wife's family is here, so I've done well in terms of where I've landed. Thank you very much. And I've asked also to be on this because there's an opportunity to do some big work in this state. And I'm very excited by that. Every day, our department faces just a whirlwind of mental health issues. And at the end of the prison system, and I'm sure our county friends, these folks in their county systems too, you go like, if we just had that person earlier on a different track, that maybe I wonder how many people that are sitting on my prison beds right now would not be in those beds had we had appropriate strategies and interventions. So it's a big win for me that whatever work is done in this area, and maybe I'll enjoy the fruits of that, but maybe I won't, depending how long it takes for us to get there. But at least let's get ourselves pointed in the right direction. You know, I deal with every day with people who think a response to most every problem is just we need more prison beds. And of course, I think the converse is the answer, right? Is that both strategic and sensible strategies, of course, not only dealing with criminal justice issues, but of course, those are such brothers and sisters, right, of mental health issues, because we know that our prisons are full of people with schizophrenia, serious psychiatric conditions. Prison is not an ideal environment. It's not an ideal environment. And so there's some big wins for us to put down all of our little chips that we think we own. And I'll tell you right now, we spend a whole bunch of money and a whole bunch of positions that we have dedicated to this department. But I would tell you right now, could you first put them on the table? They don't necessarily all have to belong to us anymore. And what we do with all those positions, that if we can do a better way of doing delivery, not only in the prison system, but elsewhere, what we're doing. And I'll tell you later about why I think there's a thought there. Not my idea, but some of the other Scandinavian countries about how they deliver mental health services inside the prisons. It's very different than our model here in the States about how we deliver mental health, even in the prison system. So there's some really big reasons, and I'll just give you on a practical aspect. I've been here on a very ground level, just to kind of shake the gravity of why I think this is important, is that in the 6 months I've been here, I've had 2 officers commit suicide. 2 officers have committed suicide. I've also, in the 6 months that I've been here, this weekend, we just had another inmate jump off the 3rd tier of a prison dorm. And so the environments, even in a good prison environment, even in the best, people are experiencing tremendous psychological problems. And by the way, not to mention the fact that prison itself is a traumatic environment. And so I'm doing everything I can to change that environment, to normalize the environment, as the Norwegians call it. So I think I'm not sure how many more of your meetings I can get to, but I wanted to tell you that I'm all in, and I will move my department around to meet wherever we all start to go. I think we should go in terms of big lifts, and to quit owning what we think we own, because I have a over $900 million budget, and we spend a huge portion of that dealing with mental health issues of people in our custody, which that won't change because some people commit serious crimes. But I have to tell you, boy, isn't there an opportunity now in front of us as well. That's why I wanted to show up today. And I hope I'll try to make as many as possible because I think some of these big course corrections have to be made at the executive level. And I want to make sure people in my department, 6,200 people work for me, understand if we are making a course correction, that's where we are. So it's good to be here. And plus I dig Michelle Barnes.
Ginny, before you go, I just wanted to, that clock's a little fast. We have about 15 minutes to go on the time for intros, and we have people on Zoom. So I'm going to switch to them next. So this is your warning out there in the ether that I'm coming to you next. So be prepared online after Ginny, and then we'll run the room that those of you members of the public have an opportunity to introduce yourself quickly. Thanks.
Good afternoon. I'm Ginny Brown, and I'm Deputy Executive Director of Department of Regulatory Agencies here on behalf of Patty Salazar. And just so you guys are aware, DORA is really an umbrella for the regulatory structure in Colorado. So in addition to the Division of Insurance, we also oversee the Broadband Deployment Board. And then we also license all professions and occupations, or probably 98% of professions and occupations in Colorado. And we're excited to be here. I have to just give a shout out to the administration because I've been in state government for probably about 20 years, mostly as a legislative liaison. And this is the first administration that I've seen that was really required that the departments work together, talk together, streamline kind of what we're doing. And it just actually makes so much perfect sense. I also have a master's degree in public health, so I understand kind of the healthcare world. And additionally, on a personal note, there's a lot of mental illness in my family. And so as a Colorado native, I've really mostly seen Colorado still be kind of pull yourself up by the bootstraps kind of mentality. So I think it'll be nice if we can make some significant headway. And I look forward to participating. Thanks.
Great. So patient friendly. I'm going to let Emma go first. And Emma, I'm hoping you can hear us. We've been texting wildly back and forth. I'm going to ask that the members of the public who are joining us by Zoom give us your name and organization, and then move on so that we make sure we have time to get to the task force members in a lengthier introduction, lengthy but succinct. So Emma, are you there?
Hey, Stephanie. Hi, everyone. My name is Emma Gilchrist. I'm Deputy Director of the Farley Health Policy Center and really excited to be part of the facilitation team for this work.
It sounds like we're having some difficulty with mics in the room getting your sound to us for those of you on Zoom. So let's run the room for those who have joined us from the public today. And I'd ask for your name and your organization so that we have time to get around to everyone, if you don't mind.
Sure. Morning, I'm Doug Muir. I'm Behavioral Health Service Line Director with Centura Health, so representing our communities and 17 hospitals.
Jacob Rogers, I'm a reporter with the Gazette newspaper in Colorado Springs.
Hi everyone, I'm Moses Gurr, the Director of Policy and Member Engagement for the Colorado Behavioral Healthcare Council. CBHC is a membership association for Colorado's 17 community mental health centers, 4 managed service organizations, as well as 2 specialty clinics.
Hi, I'm Alex Suen. I'm a reporter at Colorado Community Media. We have weekly papers across the Denver metro area.
Good afternoon. My name is Adam Zarin. I'm a policy advisor for Governor Jared Polis.
Hi, I'm Renee Marquardt. I'm one of the ex officio members of the task force. I'm the Chief Medical Officer for CHS. I've just started the position a few weeks ago, and I'm thrilled to be coming on at this time where behavioral health is such a high priority in the state. I'm excited to be part of this. I'm Sarah Fleming. I'm a reporter for Denver Westward.
Hi, I'm a manager of public policy with the Colorado Hospital Association, and we represent over 100 hospitals throughout the state.
Hi, I'm Debbie Wagner, and I am a contract lobbyist who has several clients interested in mental issues, the Psychiatric Society, Jefferson County Human Services, Alcohol Veterans Center, and City of Trinidad.
I'm Betty Palmer-Gog here. I'm here as a parent. A young adult that has severe mental illness and substance abuse issues. And hopefully other parents like me who are going, what the heck's going to happen when we're gone? So pray for us all.
I'm Margaret Elmer. I am the president and acting executive director of NAMI Colorado.
Charles Davis, Chief Executive Officer with Crossroads Turning Points. I represent 21 counties in southern Colorado, Southern Forest. In the state, we just have
Hey, I'm Mary Peck. I'm with the Department of Agriculture. Got here a little too late to get to the table, but I'm representing Commissioner Kate Greenberg. And we're so excited to be part of this. This is my 2-month anniversary, so I'm getting up to speed on everything myself. But I can tell you in 2017, we initiated a partnership with Colorado Crisis Services, and have really been promoting that hotline. As some of you know, crisis hotline. It's been in a little bit of a lull period with the transition. I'm the communications director there. We're a lean agency, so I will be heading that up and just really looking forward to ways to enhance that coverage and leverage partnerships and really bring the attention needed to the rural areas. Again, my background is in communications, but I grew up in Southeast Colorado, Southeast Wyoming, in a very rural community. So I feel like I can speak that language pretty well and bring that perspective to the world. So thank you.
I'm Christina Martinez. I'm the chief of staff to Lieutenant Governor Lee, and born and raised in the San Luis Valley, so rural is always in my heart.
Hi, I'm Robert Werthlein, the director for the Office of Behavioral Health. I'm also a parent of a young adult who is a consumer in the system, and I'll be co-chairing the safety net system with Commissioner Jackson, and as interim co-chair for the long-term competency committee while we hire.
Good afternoon. My name is Misty Ruthven. I'm the executive director of Pathways and Education, representing Dr. Kate Dantas, Commissioner of Education. Thank you to Nancy, representing K-12 on this conversation. We know that this is a critical conversation for the students and parents across our state, the nearly 1 million students in K-12, as well as the 300,000 folks, adults without high school diploma that we also represent in our state. So thank you all, and we'll definitely be here learning with all of you beside you. This is something that Andrea, who is also from CDE, will discuss a little bit more. She has a unique position at the Colorado Department of Education, and just know that we definitely see this need as well as hear the need from our schools and districts across the state. I might be able to contribute as a systems thinker. I've been in state service for about 2 years.
Hi, I'm Andrea Polskamp with Colorado Department of Education. I'm the state transformation specialist leading the school climate grant centered on developing a framework for behavioral school climate services throughout Colorado. So I'm very interested in hearing what comes out of this and hoping to contribute in whatever way makes sense.
My name is Avery Sherman with the Capstone Group, and we're a contract lobby firm, and we have several clients interested in behavioral health issues, including the Kemp Center, Colorado Psychologists Association, and Children's Campaign. So.
I'm Mark Harlock. I'm the new Colorado corridor for Kaiser Health.
You guys will hear more from me later. My name is Penny Teeters, and I am Jill's mother. And I'm here to escort her back and forth as she drives to the grant.
She's my co-pilot.
Good afternoon, everyone. My name is Gene Suchia. I'm with the public policy team at the Colorado Health Foundation.
Hello, I'm Debbie Stafford. I'm the Legislative and Community Director for the Aurora Mental Health Center. I also am a forensic treatment provider treating offenders. I've done that for 27 years, and I serve on the DORA Registered Psychotherapy Board.
My name is Ann Noonan. I'm here representing the Health District of Northern Larimer County. Most recently, I helped facilitate the MSO for Boulder County, and so I've had the opportunity to be at the table with many of you. Appreciate being here.
My name is Representative Mary Young. I'm the newly elected and sworn in representative for House District 50 in Northern Colorado, Greeley, Evans, and Garden City. I've spent the last 38 years working in public education as a school psychologist, special education teacher, and a variety of other things, including special education administration. I'm also the co-guardian of my sister-in-law who's duly diagnosed with IDD and some significant mental health problems. So these are issues near and dear to my heart.
Good afternoon, everyone. Doyle Porcelain with the Colorado Behavioral Healthcare Council. I'm also on the board. I serve on the board of the National Council for Behavioral Health. So I look forward to participating in these meetings, and as much as I can provide both a Colorado as well as a national perspective, hopefully that can be useful over our time together.
Hi, everybody. My name is Frank Cornelius. I'm the Director of Government and Community Relations for CBHC, Colorado for Behavioral Healthcare Council. I am on the Safety Net Subcommittee. I currently serve on the Behavioral Health Planning and Advisory Task Force. I was the last co-chair of the Behavioral Health Transformation Council before it was sunset by Representative Krafthar. But task forces that I've been on my share, and I'm really looking forward to participating on the Safety Net following the work of the task force. Thank you.
Thanks, Frank.
I'm Erin Torrance. I'm a program assistant at CDHS.
I'm Madeline Rubel, Deputy Communications Director at CDHS.
I'm Mark Texmeyer. I'm fortunate enough to be Michelle Barnes, Director of Communications at CDHS.
My name is Lucy Reed. I'm the Director of Early Childhood Programs at Catholic Charities down in Pueblo, and also will be sitting on the Children's Behavioral Health Subcommittee.
I think we got everybody in the room. Did anybody sneak in and out? Or we miss anybody? All right. I am going to call a break until 1 o'clock, and we're going to try to get the mics fixed and then maybe come back to those who are joining by Zoom for introductions. And I appreciate your patience. You know, nothing like jumping out of the gate with technical difficulties. So we'll reconvene at 1 o'clock. Okay.
She killed it.
Reading a good book home.
Yeah, so Dave Long, there's a lot of good arguments. Dave gets that before the time. So he's going to be the
Please, Steph, can you hear me?
It's different because everything else they
No.
Hi, how are you? Good. So, you and Grand Junction? Yeah, well, I have, you know, I'm gonna go back and I was there a couple times. Yeah. But I wanted like 10 pieces. We ran out of car accident. There's a lot going on. We should be, you know, really sure. Oh yeah, oh yes.
Number one issue.
Hello?
Hey, Jonathan, is that you?
No, this is Raul de Villegas.
Oh, okay. They are working on the mics in the room, and we should, all participants on Zoom.
Do they want us to call in and use a computer audio or stay on the phone audio?
I'm gonna stand, where's the green light? I'm gonna stand as close to it as I can.
Right here.
And Jonathan's gonna unmute, or if you can't, unmute yourselves, so that we can start with Emma. Can we do a quick test on the Zoom line, please, that you can get into the room?
Hello, can you hear me?
Yes. Sweaty. All right, Emma, I'm gonna introduce you in a little bit and let the task force members have a moment so that we can get on time. But Emma is part of the Farley Health Policy Center team and is joining us from somewhere in Southern Michigan. And thank you for joining us, Emma. We're excited to have you back at the next meeting. So next on the list I have, and please forgive me if I slaughter names. I'm gonna get to know you, but right now I'm just guessing. So Amber Courtier.
Yes, that's correct. Hi. Good job. Yeah, this is Amber Courtier or Courtier, either one. With Centura Health St. Anthony North ED initiated medication assisted treatment program and expert program.
Great. Thank you.
Thank you.
And I will just say that Amber just did an ideal job of introducing herself, since we're going to try to move through this as quickly as we can. Love Amber. Okay, so Della.
This is Della Vieta. I'm the Director of Alamosa County Public Health Department. And I'm also the current chair of the San Luis Valley Public Health Partnership, which is comprised of Alamosa, Conejos, Costilla, Rio Grande, the Watch Public Health Agencies, and the Silver Thread Public Health District, which includes Hinsdale and Mineral counties. My agency here in Alamosa provides services both locally and regionally. And we encounter behavioral health and mental health needs in a lot of those arenas. We've got care coordination services for children and youth with special health care needs. And we also have an interagency operation oversight group, which oversees the wraparound services in our county. And we've got a case management service for adults and children receiving home and community-based services in the region. And we've got a regional home health program. So it was important to me to not only represent my county, but to represent that rural and frontier voice here in the San Luis Valley. And I'm really happy to hear that several of my other colleagues on the task force are representing rural and frontier voices as well, because I think our challenges are a little different than some of the challenges in urban areas. And so I'm happy to hear that we've got a strong voice on this task force. And I guess the last thing I wanted to say is that our role in public health is as a community convener oftentimes. And those of us in rural and frontier communities tend to wear an awful lot of hats. So I'm hoping to bring as many of those various voices to the table to fully represent the need and the opportunities in our community.
Great, thank you, Della. I have Raul de Villegas Decker next.
Hey, not bad at all. How are you, everybody? My name is Raul de Villegas Decker. I'm a clinical psychologist in Grand Junction, Colorado. I'm hoping to address the lack of access and quality care in the Western Slope, especially for children, substance abuse treatment, the Latino population, and veterans. Thank you.
Oh, you did a great job. Thank you, Raul. Okay, I have Kali CD.
Just keep doing that. Hello?
Hi.
Oh, I'm assuming this is me, because I'm calling from the state hospital. Hi, my name is Dr. Carol Collier. I'm a psychiatrist at Colorado Mental Health Institute at Pueblo. I'm actually employed by the University of Colorado and contracted here. I'm also employed 1 day a week at the Vista Women's Correctional Facility. I'm also the parent and guardian of a young adult with mental health and substance abuse issues who is actually committed to Colorado Mental Health Institute at Pueblo.
Great. Welcome. All right, Becky, Ella, I wonder if your name got cut off.
Hi, no, I'm here, and it's Ela.
Ela.
Yes, so my name is Becky. Hello, everyone. I am a licensed clinical social worker and the behavioral health director for Delta County Memorial Hospital. I live in Delta County, which is a county of 29,000 people, so very much represent integrated care in our primary care clinics and frontier life.
Thank you. Stephanie Brinks.
Did you hear me?
Yes. For a second, we could.
Oh, can you hear me now? Sorry.
Yes.
Okay, I'm Stephanie Brinks. I'm the behavioral health coordinator with St. Anthony North Health Campus.
Thank you. Camille Harding.
Hi, I'm Camille Harding. I'm the division director for community behavioral health with the Office of Behavioral Health.
Well, that's okay. Corey Notestein.
Hi, good afternoon. It's Corey Notestein, Executive Director of Student Success and Wellness in Colorado Springs School District 11, here representing children and youth and their families in K-12 education.
Great, thank you. All right, this one's going to be tough. All we can see is Godinez D.
Hi, can you hear me?
Yes.
Yeah, so my name is Dietrich Godinez, and I am a child and family researcher here at the Office of Behavioral Health. My work focuses primarily on youth and young adults who are involved in multiple systems, so almost all the systems mentioned, part of rural and frontier communities, and then just also wanted to mention part of a collaborative effort to build a shared common assessment and level of care tool.
All right, next we have Kellis. Recognizing that some of these are probably getting chopped up by Zoom. All right, we can come back to that one. How about Lauren?
Hi, can you hear me?
Yes.
Hi, this is Lauren Snyder. I'm a member of the Safety Net Subcommittee and State Policy Director with Mental Health Colorado.
Shannon.
Hey, can you hear me? Hello?
Hello.
Hi, this is Shannon Van Diemen. I'm the Vice President of the Pediatric Mental Health Institute at Children's Hospital Colorado. I'm also a board member of Mental Health Colorado and a co-chair of the Children's Behavioral Health Subcommittee for the task force.
Great. So now we're moving into those who have joined by telephone. So the last four digits of the phone number are 9767. How about 7732?
Did you hear me, Stephanie?
Yeah.
Stephanie, this is Linda Niebauer from the Farley Health Policy Center.
Place that's near to my heart. Hi, Linda. All right, what about 5100? All right, 2857. I feel like I'm playing bingo. And is at the bottom of the list? I think we Stephanie Glover.
Hi, this is Stephanie Glover with Colorado Access.
All right, I think we got everybody who I can see. Is there anybody who didn't get an opportunity to voice themselves in the introduction on the phone? All right, Zoom is working and the clicker is working. Okay, great. Maybe it's not. I think we can get some slides from the computers and we'll figure it out. I want to move on to introducing summer. And I want to tell you all that my favorite part of my job is doing the stuff we're going to get into when we work in groups, the kind of facilitating process. Maybe I mean, I wish we lived in 1935 and we're just forced to all be here together. So I appreciate your patience as we navigate through trying to get this working. So Summer is going to help ground us a little bit on what we know. She sent out some readings ahead of time to really get everybody's juices flowing around what got us here. And we're going to spend the next few minutes hearing from her to orient us really to the work of the task force. So thank you. This is her. Okay. Excellent. Thanks. Hi, everyone. So before we jump in, so we're going to spend just a couple of quick minutes with me just kind of grounding everybody, kind of doing a very, very quick, like 30-second refresh of all the readings that we sent out to you ahead of time, which is why we sent them out to you ahead of time so that you had a chance to kind of review them, digest them, and we could make the most use of our time today. Before we jump in, because I am going to be talking with all of you over the next year. I did want to quickly just share a little bit of my background. So I'm a former CPA, which means I love to crunch numbers and get into Excel spreadsheets. I quickly left the corporate world and started working in direct service. I was working directly with homeless and low-income individuals to help prepare them for the workforce and get them into jobs. And as you can imagine, during that time, I worked with a lot of people who had behavioral health issues. I then started a nonprofit, ran that for a number of years. I was living in DC at the time. DC elected a new mayor, Mayor Adrian Fenty, and I was recruited to run the DC Department of Labor. So I did that. Then I did the typical DC thing, leave government, go into consulting. I was a consultant for a number of years in DC, got tired of the rat race in DC, and came out to Colorado in 2012. Started consulting in 2014. My very first project as a consultant was with the Denver Foundation, who received $40 million to increase access to healthcare across the state. We did asset and gap analysis, identified that behavioral health was the biggest issue, and decided to develop our grant-making strategy around that. So I was in charge of kind of developing that grant-making strategy, getting that project off the ground, and did that for the first couple of years until they were able to internally take it and run with it. I have worked with the Colorado Health Foundation. I have worked with NAMI in Colorado Springs. And then last year, a lot of you know me because I had a chance to facilitate the Crisis Steering Committee with many of you who were in the room. And I always talk about that work as it's probably the hardest project I've ever worked on. And that says a lot coming from DC government, but also one of the most rewarding at the same time. So I'm really delighted and excited to be here and to be part of this. And we're going to talk a little bit about how this is going to be different from other task force. First, I want to kind of start with what do we mean by behavioral health? So this definition here on the screen, can we minimize the participant so we can see it? Yeah. So this definition here on the screen is what is in legislation SB 19-222, the Safety Net Committee. Essentially, what I would share is that behavioral health is the umbrella term for mental health and substance use disorder. That is how we're using it. And I think that's really important to emphasize because a lot of us talk about behavioral health in different ways. Additionally, when you read about the materials of the task force, there is a huge focus on mental health. And I want to make sure that we don't lose sight of the substance use disorder. So I'm going to be the little person in the background saying like, what about substance use disorder? What about substance use disorder? Because that's just as important and we cannot lose sight of that. But I want to make sure that we're all using the same definition.
Like a blanket.
I know. Okay, can we go to the next slide? Okay. So the other thing I wanted to talk about, I've had some slide with some stats around, you know, really how bad behavioral health is in Colorado. We are near the bottom in almost every kind of survey and analysis that is out there. So I really want to make sure that we don't spend a lot of time validating or verifying that the system isn't working. We kind of know that already. So I really want to focus on what are the solutions? What are the recommendations? And to be honest with you, I think about this in terms of
when I ask other people, what other states have a comprehensive behavioral health system? The answers I get are, Oregon's doing this piece well. Virginia's doing this piece well. Massachusetts has figured this out, but nobody has comprehensively developed a behavioral health system. I want Colorado to develop that system so that in 5 years, 7 years from now, when people say, what states have figured it out? Others are saying, it's Colorado. Colorado figured it out. So that is how I want to think big and bold, and means that we need to think big and bold and revolutionize and just think differently than we have before.
So can I ask a question?
Yes.
This is just kind of about what's on the table for the work of this group.
Yes.
So I think about health, and then I think about health care as distinct things. Behavioral health is distinct from a behavioral health care system. And the contributors to positive behavioral health delivery. I think about housing, and all social determinants kind of stuff, and the environmental factors that contribute to whether or not you may ever even need to walk in the door of Solus to help for treatment. Are we going there with this? Are we talking about behavioral health system in a provider system?
So it's a great question and a great segue into my next slide.
I set them up.
Setting it up, yes. So real quickly on the next slide. The structure for this group, obviously we have our task force. Really all of you are our system thinkers. We need you to help us connect the dots, identify the gaps, identify the needs. Per legislation, we've got these 3 subcommittees, right? So we've got children's behavioral health, safety net, and competency, all of which we'll talk about here in a minute. That does not mean that's it. So it's really up to this task force to define what else do we need to include. Do we need to have other subcommittees? You know, we are not beholden to this. We can add, we can change this. So we do need to talk about that as a task force. So I think that's a great question for us to talk about and to figure out. And I would say too, yeah, just to say, I mean, we're just not beholden to this. We can move this around and we can change it as we need to. I mean, that's the great thing about kind of having the political will to make real change, is that we could come back and say, actually, we think we need to focus on this, or we also need to do this. And that's the beauty of it. You know, just to talk a little bit about kind of the blueprint, we've referenced that a year from now, we're going to have this blueprint. The great thing about where we are right now is that I've got an entire Excel spreadsheet of all kinds of reports and research that have been done over the past 10 or 12 years. We have more data than we probably know what to do with. So we have a great foundation. What it also means is that we already have a lot of goals and strategies that have been identified. What I want our blueprint to say is not just the goals and strategies, but who's implementing, how are they implementing, what's the staffing, what's the resources, what's the public policy. I want it all comprehensive, laid out year by year, so that 2 years from now, if something doesn't get done, we can go to our community partner, we can go to our agency partners, whoever it is, and say, so what happened? Why didn't it get done? And everybody knows who's responsible, because we have to hold each other accountable. It's the only way that we're going to make change. So I just wanted to make sure everyone understands how this blueprint is going to be a little bit different than I think we have had in the past.
I assume we're going to be making recommendations about how money is spent. But are there going to be additional funds put towards what we're putting out in these blueprints? Or is it just that we're going to shift money around that we already have? I mean, what's the governor's plan?
So I don't know if I can speak about the governor, but I will just share
your knowledge.
I mean, I'll look to the executive committee, but what I would share kind of my philosophy is, we have a lot of money. Let's figure out how we're investing it first. So part of the work is going to be doing a financial analysis to understand where's all the money going into the system.
Piecemealed in a way that's not effective.
Exactly. Right. Any members?
The first thought is to throw more money at it, because that's easy.
Yes.
Let's get a system and figure out how much we need to invest. Okay. I just also add, whatever you solutions compare and contrast now. That's what's not working. So I'm willing to look at requests and all sorts of things and deal with stakeholders and
That's where the difficult conversation comes in. That's why I appreciate your introductory comments and everybody coming in here has to do what's right. For the folks seeking care and less territory, a little more to do what's right, and then we figure out how to get there.
Yeah, I agree. We're all starting out on friendly terms today, which is great. I love to see that. It's probably not always going to be friendly. I think we're going to have some tough conversations. And part of what we're going to talk a little bit about this afternoon is how do we have those tough conversations? Because we're not always going to agree. And I will tell you, I will also be the person, to Kim's point, who always comes back and says, is that the best thing for the consumer? Is that the best thing for the patient? Because that is what really matters, is making sure that everyone who needs help gets it. So we can go on to the next slide. Again, I'm going to go through this very, very quickly. For the children's subcommittee, the Partners for Children's Mental Health put together the roadmap. We included that in the readings that went out. What I can tell you from looking and reading that is that there's already a tremendous amount of work that has been done around children's behavioral health. So that starting is kind of diving in, looking at that and building from that, because they already had hundreds of conversations with hundreds of stakeholders and organizations. So we'll start there and look at what their goals and recommendations were, and then kind of go from there with that subcommittee. Next slide. Safety net. So Safety Net Committee has a really big lift. So they're going to be kind of looking at what are those wraparound services that people need in order to be successful and sufficient to the degree that they can. What are the legislative recommendations? What else is needed? This is where we'll also be looking at where are the gaps in the communities across the state. What are those gaps? How can we address the gaps and the needs? We'll look at funding models. So that this Safety Net Committee will be looking at funding models. As a task force, we'll be looking at funding models and really looking at analysis of like, where is that money going in? And then we'll look at kind of where is that continuum of care that we need to make sure is addressed in the safety net. So this again is going to be a pretty, well, they're all really important subcommittees, but this one will probably have a very heavy lift because it's not as much foundation from what we've got for some of the other committees. All right, going on. So our long-term competency committee. So as you can see here in some of the numbers, the increase in competency evaluations and restorations have increased incredibly over the last decade or so, more than that. In 2011, Disability Law Colorado sued Colorado Department of Human Services because there's for the idea that there's too many people in jail who are taking too long to get help and to get access to services, and it was not within their constitutional rights. So after years of going back and forth, litigation, mediation this year resulted in the consent decree, which we also shared with you in some of your readings. And we have started to develop kind of a framework for that, kind of how do we make that system work? How do we make sure that we're not seeing numbers like this and that people are not stuck in jail because they can't get services quickly? So we've got a good framework from there from which to build. And that committee is probably the one that's under the tightest timeline because we need to have some initial work done by January of 2020. That's again, quick overview. We go on to the next slide. So just to recap in what I shared in talking very fast. So we know the system's not working. We have some clear direction with the subcommittees in terms of what we're going to do. We have a lot of work from which we can build, so we can use that to our advantage. And we need to stay focused and realistic, right? So I talked about having a system, a comprehensive system that works for everyone that other states look to. That's not going to happen in 2 years. It's not going to happen in 3 years. So in addition to kind of thinking big and revolutionary, the other thing we need to think about is what's realistic. And that's why I really want to break it down year by year. So we can say, what can we realistically do in year 1? What can we realistically do in year 2 and build it out and know that we're not going to get to it all, right? So in that blueprint, there's probably also going to be an addendum that says, here's all the things that we talked about that we didn't get to. Here's all the things that need to be addressed in years 4, 5, and 6. So we are really kind of forward thinking, but laying that strong foundation. Other things that we're doing, just so that you know, legislative review, there's been lots and lots of legislation that has been put forward over the past couple of years. We want to take a look at that. Make sure that that's the legislation that we need, understand if there were any unintended consequences that we need to be aware of and to be thinking about. So we've started looking a little bit at that legislative review already. Financial analysis, that'll be a big, big piece of it to make sure that we understand that. Looking at reports and best practices. Again, we have lots of reports, not just from within Colorado, but from across the US. So making sure that we're leveraging those, and then community input. So I'm having lots of community conversations across the state to make sure that all of our stakeholders feel engaged, they have a chance to provide input to this process, to provide their solutions, to provide their recommendations. And I'm determined to hit every single community that I can. So I will be traveling a lot over the next year.
Can I add that this committee is welcome to join you?
Yes. Absolutely. You're welcome to join me. You're welcome to invite me to your communities, and I will gladly come out to have those community conversations. And we'll really look to you to inform me of what's the best to structure that community conversation. In some places it might be small, in some places it might be let's go big and let's have a huge community conversation. We can definitely do what's best for what works best in your community. So thanks for reminding me of that. Okay, so I did that really, really fast. Just to touch base in terms of the readings, is there anything that people want to share? And again, we're doing this in like 3 minutes. Anything that people want to share in terms of what they were surprised at by the readings, or things that they were surprised were not in the readings? All right, hold back your enthusiasm, everybody.
Anyone read it?
All right. Yes, Robert.
Some of the same things are being said over and over again. The larger solutions than not just what the solutions are, but how we enact them.
Yeah, agreed. So to make sure everyone heard that, it's about what the solutions are and how we enact them, so that we're not having the same conversations 2 or 3 years from now. So a couple final things before I hand it over to our communications team. Everyone should have received from me on the task force your expectations document. If you don't have it, or if you haven't submitted it, let me know at the next break, and we can make sure that you have a copy of it. The reason that we asked everyone to look at that and to sign it is because this is a heavy lift. This is not, let's get together for coffee once a month and smile and talk to each other. This is really about going deep and doing some hard work, and it's going to require us to kind of roll up our sleeves and dig in. So I want to make sure that everyone understands that. The other thing that you'll find in your packets for the task force is we do have some ability to reimburse for travel. So there's some guidelines in your packet. We can follow up with you after this meeting to make sure that those of you who need reimbursement can get that. But just know that there's some information in your packets as well. Any questions about any of that? Okay, so before I hand it off to communications, I'm just going to say I am so thrilled to be working with all of you as we're going around the room. The different points of view, the expertise, and most importantly, the passion is really impressive. And we are going to do some really amazing work together, and I look forward to it. So thank you. And with that, I'm going to hand it over. Yes, question?
Why is there a W9?
Why is there a W-9 in the packet? For those of you who need travel reimbursement, we'll have to have you complete that so that we can, if you don't need travel reimbursement, don't worry about it. Good question, thank you. All right, I'm gonna hand this over to Mark, our Director of Communications.
Hi, everyone. Thanks for giving us just a few minutes. I'm Director of Communications at CDHS. Madeline Rubel is our Deputy Director, and we're going to kind of trade off here a little bit back and forth. We've both been involved in our careers in some large incidents, large initiatives, critical incidents that affected large populations, but neither one of us have been on the foreground of a movement like this. And as far as communications, we couldn't ask to be in a cooler situation right now, because this is where the metal meets the road. Michelle, my boss, said at one point, we've got to make sure that people understand this is not just another task force. That we are going to do some serious hard lifting, as Summer was just saying. And how do we communicate that? Everyone in here is communicators. How do we communicate to our Coloradans that we are doing the work, look at our progress? And we got some ideas. I started off with our website. Please check out the Behavioral Health Task Force website. Also, our Twitter feed. We've been tweeting live from this morning as well. We're going to have a bunch of neat things that are going to allow us to share that information. Maddie, talk more about that.
Twitter feed?
Yeah.
On that Twitter feed, hopefully you guys have all checked in today. We've had some posts from here in the room as well as the video. So if you don't get it up today, you can check it out there. We'll have some posts coming from our Facebook page. So we have a Twitter dedicated to the Behavioral Health Task Force, and we'll have general Facebook posts coming from the CDHS Facebook page. In addition to the website, we'll also be creating a newsletter. You guys will start seeing that drop in your inboxes bi-monthly, about typically twice a month, of course, having some flexibility if we get exciting news. So in that, we'll be sharing with you links to previous minutes. Of course, if you miss it or want to share them, they're not quite as sexy as some of the other stuff, but got to do our due diligence. We'll have some victories that we're working on and things that we're really excited about, and some of the discussion and action items coming out of here. We'll also be sharing some challenges and potentially some questions coming with that for engagement, so that as you guys think and noodle on some things after we leave this room, you can send more suggestions and other thoughts. We'll have some potential profiles of board members, of committee members here, of consumers, other potentially staff, if we want to feature some of the staff that are working in the system to share some stories. We know that there's a lot of you and a lot of people on other committees, so we want you to at least feel like you can get to know each other virtually a little bit. And then we're of course open to ideas. So as they start rolling, if you have something that you really feel is burning that we must have to share, please send it over. But we've got a few different channels of communication that you guys can rely on in addition to blowing up Summer's email, but we'll try to relieve some of that.
I want to thank our partners in media for being here today, the Gazette and Colorado Community and Westward. And when I say partners, that's what this is. Especially the Gazette, who's been doing a year-long series on mental health and has been doing an outstanding job. And I mean, it's broken, right? We all know it's broken. And it's okay to sit there and talk about it so that we fix it. And it's okay for it to be out in the media that what we're doing is not working, but we're working on making it better and changing this whole blueprint. So we will be working with the media a lot. We're going to be pitching stories to media nonstop. You will be seeing a lot of coverage on this. As far as the communications department, really fortunate to have Maddie, but I've got digital communications manager to put all this together for the Twitter feed and website and all the rest. We're all on board on this. So let's talk about the media in the room. So how to handle media if you're approached. One thing we want to do in our messaging throughout this task force is to be consistent. So we ask that if you have a media approach you with any questions about work that may be going on with the task force, just you can put them right to us. If you want to talk to the media, absolutely welcome to do that. We just ask that you stay consistent with our messaging. And how do you do that? We're going to send some things out as well. There's also, we'll throw the offer out there that there's also media training available through CDHS with my team. If anyone wants to partake on that, we will come to you. Happy to do it. But excitement is big too, because we don't want it to be another task force, right? So the little video mashup that you guys didn't get to see this morning, it's pretty funny and it's cute and it's cool and it's engaging, and you may think, well, we're working on really serious stuff here. Yes, we are. But to get the attention, grab the attention, we also have to reach people where they're going to watch it. No one's going to go on the website to read the minutes, but they may go to the website to see a video they saw tweeted out of our executive board being silly about something. When I say silly, I also mean on point. So we're going to have fun with this, and we're going to be active and aggressive, and we're going to be working with the media, and we're going to work with all of you. We're 24/7, and we can help you out with anything you may be stumbling across and having any issues or any concerns. Maybe you don't like the way something was posted on the website, or how it said something, or we didn't think how it affected HICPA or whatever department. Let's talk about that, and let's get it fixed and work together as a team. So we're excited. I hope you guys are excited, and if you're not, we're going to get you excited. So thank you for your time. Any questions? All right.
All right, I've been instructed by Jonathan to stand in the center of the room so that the Zoom people can see me. So here I come towards the camera. So thank you, Summer and communications crew, because we are exactly on time now. And so my blood pressure just dropped. So everyone should take a breath and feel like we're on pace. That's good. So Summer mentioned, I stole this slide from Summer, by the way, so I appreciate you letting me do that where you are in the room. But this work is challenging, and it sounds like in listening to you, and I'll introduce yourself this morning, most of you have experience in working in these cross-sector task force kinds of situations. And I think that part of coming in to be able to have the kinds of conversations that you're being asked to have by the governor, by the lieutenant governor, by Michelle today, we have to kind of call out the elephant in the room around these conversations are hard for reasons we've all experienced. We have different perspectives. There's business models that can potentially be impacted. I've already heard from almost everyone about multiple hats that you wear when you come into these kinds of conversations, not to mention the history that many of you have working together in the past. And so really trying to, I think, just intentionally acknowledge it as each of us are here. It doesn't mean that this stuff's going to go away. It doesn't mean that we're probably not going to build some more of it through these conversations. But I think what the Farley Center team really wants to try to foster is a place where people feel like, regardless of this is a place to speak. It's a place where you can be heard. What we have found in other states when we've worked on this, we've worked in many other states with trying to do a similar thing around redesign of behavioral health. And Shale, please feel free to jump in here at any point. But what we have really found in most situations is that being heard is what is valued almost 100% of the time over getting your way. So if people feel like they've been heard and considered respectfully, they're kind of, when the time comes to make a compromise, they're more likely to go there. And so that's what I'm hoping we can support and foster in this group. So Sheila, I don't know if you want to add anything.
Oh, keep going.
All right. Does anybody have any comments about this before we move on? I feel like I kind of preached a little bit there. Good? All right. Thanks, Jonathan. Yes.
So the only thing that I would add is just in terms of wearing multiple hats, I would also ask if people are sharing or if we're having a discussion around something that's a conflict of interest, to make that known so that we all understand that.
Yeah. Thank you. Oh, sorry. Was there something else? I'm in the middle of the room. I feel like I'm in like,
You're great. You're doing great. I'm just curious, is there going to be a mechanism by which people can actually say that they don't feel that they've been heard? Or like, I mean, is there going to be like an ombudsperson if somebody feels like they're constantly being shut down or not being respected? Or can we as a group, if we witness it, can we say, hey, I think you need to listen a little bit better to what this person is saying? It's great to do this, but how to operationalize it is really important, I think.
Two things. I'm going to push one to probably Michelle. But the first thing I'll say is that we had talked before the meeting of creating a space between meetings, kind of probably in the form of a survey. We need to kind of figure out what the best mechanism is, but for you all to be able to share information back to us, so things that you might not feel comfortable sharing, that kind of feedback, that's another venue to get to the operating team in a less public way. So that's one thing. An OMSPITS process, Michelle, I'm not sure if you want to speak to that. I'm not sure if it was, we had discussed that.
I think it's a great idea. Does anyone have an idea of what's worked in other task force events? I was going to say you can all text me, but that's probably not probably not a good answer. Your phone number then?
I'm a fan of you bringing your interest here. What I'm not a fan of is everybody coming to us individually to make sure that they're lobbying their own agenda.
Exactly.
So please have the courage to bring it here so we can actually be transformational with everything on the table and have the hard conversations here.
And Michelle, I think it's also a role for the chair and the vice chair. If that's happening, that's occurring, that's why we have chairs and vice chairs of these subcommittees. So have the conversation. If you don't feel comfortable having it in the big group, have a conversation. Have one up, you're being respected, and approach it that way.
Yep.
Yeah.
I'll say when Summer did this in the crisis committee, there were folks that felt that way, and they used her as the tool. She approached me as other co-chair and said, "Here's some of the concerns." So that worked well. The facilitator sort of being the go-to part.
Yeah, well, we're certainly here to receive. We won't be, the Farley Center won't be resolving. We will be working with the co-chairs and with Summer to make sure that those things happen. But if you're feeling like something more formal would be more comfortable, I mean, we can certainly revisit this over the course of the year to make sure that we're hitting the mark. I think it'll.
We'll have chairs worked on.
We did it through the facilitator. So
yeah, I think that's right. I think that to keep it sort of streamlined, it would probably, and we'll have follow-up after each of these sessions, so you'll have the contact number, but let's just streamline it, that if there's some direct communication that needs to happen, feel free to contact us through the Farley Center, and we can feed things back to the co-chairs that way so that they're not getting too bombarded.
And I think
but hopefully nobody will get too bombarded, because I couldn't agree more than with Kim that, you know, really the more that this can be done openly, the more likely we are to be able to come to a more successful resolution. If somebody's really feeling that that's uncomfortable, we respect that.
So when we send out the communication about the between meeting feedback opportunity, we'll make sure that our contact information is connected to that, and you'll know how to get a hold of us if you don't already. Anything else?
When we get to the point of actually producing a product, I think a really important piece is going to be making sure that there is a way by which we as task force members are reviewing multiple times before something is published as the final product. And I think every once in a while there's a steering committee or a task force or whatever where you go through and it feels like a really great, genuine stakeholder engagement process, and then a report lands and you're like, whoa, that wasn't quite what I thought where we landed. So I think it's just, that's another way to really demonstrate. And maybe it does, I mean, obviously it doesn't mean everyone gets their opinion included as a recommendation. But, you know, you go back to like the 208 Commission, there were dissenting reports filed as well. So just some of those mechanisms to make sure that we recognize where maybe there was a difference. It wasn't ever settled.
Yeah.
But more people leaned this way than another way. Just that demonstrates that you were heard, it was incorporated. Doesn't mean that it was adopted. It just creates a different way to do it.
Yeah, and Summer mentioned that she had success with that with the crisis steering committee with an opportunity to contribute those kinds of things as an addendum to the reports. So we can make sure we iron that out. And I'm so glad you took us there, because I was just trying to get to July 1st. It's like thinking about the deliverables is super important.
So what I would just add to that is I think in the expectations document, it does say that like if there are people who disagree and want to include that addendum or opinion in the blueprint or final report, we can do that.
I'm missing anything. All right. I also stole these from Summer. She's been fantastic in sharing things with us. But I thought it was probably just a better use of time together to really start from here and see if there feels like there are things missing related to just group agreements and how we will operate together. And again, I think most of you have done this kind of task force work before. My favorite is the first one around charitable assumptions, that we're all here trying to get to the right point. And I think some of the visioning work we will do this later this afternoon will help us kind of define what that is and get a little more concrete about how we would define where we're headed. That everyone participates, and that's going to be a role that the Farley team will be actively managing and trying to make sure that there's opportunities for stepping forward. And if we kind of need to remind to step back, because we want to make sure that there's an opportunity for everyone to feel heard in whatever way they're comfortable sharing. Absolutely, and so important to be tough on ideas. Like, this is the crux of what we're doing here. We've been given, you know, a gauntlet to run, and we have to kind of remain critical of ideas, but not of people. So trying to be respectful of where that line is, I think we all try to do that, but when we get heated, it maybe is the first thing that falls away. We've talked about acknowledging roles and what your hat you're wearing, and kind of as much as you can come from that place in how you're representing an opinion. I think that will help our entire team staying solution oriented. Starting and ending on time. You're going to see me like sweating about that. And then just using words thoughtfully and being respectful towards one another as we go through some of these really critical and sometimes probably difficult conversations. So having considered those, did we miss anything? Yeah.
One thing that's come up in other similar group exercises is how we talk about the people affected by these problems or communities affected by the problem. I don't know if we establishing some vocabulary or something like that that really sets the groundwork for how we talk about people. Maybe we just start with that, like we say people first, but.
Other thoughts on that? Yeah.
Another piece is decision-making and maybe defining consensus. So that's been an important conversation in the past in similar groups. As far as, you know, you may not agree, but you can live with it, has been a definition.
Yeah. I don't want to move on too quickly from that though. I wonder if it would be a good use of time to, in small groups at some point, to really focus on in the agenda so we can meaningfully get to that if we need to. Unless there are suggestions about how people would like to flow, how would be about people affected.
So I'm wondering if maybe, I know a number of organizations have sort of literature on this. I wonder if it's something we could some homework reading. Terminology, because I wrote down the same thing earlier about that. So I know there's a couple organizations here that probably have pretty good literature on terminology that we can share.
Okay, we can add that too. We're going to add you and your organization to the parking lot to think about how to circulate some of that. Yeah. What?
I have another suggestion.
Oh yes,
but I don't want to move on. Using the assumption of the charitable assumption, I think that we could get around this, or that hopefully this wouldn't show up. But one of the things that I realize happens a lot in decision-making groups is privilege, people in privilege, sitting there in privilege, forgetting about people not in privilege. And privilege looks a whole lot of different ways. So I'd like for us to consider to check our privilege in conversations, because especially with people dealing with mental health illness, privilege looks a whole lot of different ways. Race, income, geography, gender, et cetera, et cetera.
Yeah. Well, and before you go, Jonathan's making notes on this, and what we're going to do is collect them and reflect them back to you before our next meeting, and so that we can kind of say this is what we came to. So.
I was just going to volunteer. I'm also a member of the Colorado Public Health Association, and health equity is a big part of what that association drives in the state. So if we have kind of a person-first language training that OVHs are reading or whatever that OVH can help bring, I can go back to that association and see if they have some literature.
Okay, thank you. Anything else? All right, you can always send them to us. If you think of something in the middle of the night, we'll take it. All right, we're moving into my favorite part of the day, where we're gonna actually put you to work and ask you to move around a little bit. So if you can have the next slide for me. And we tried to build in breaks. Oh, I need to talk about the parking lot, but we are really ambitious with this agenda today, because and I think Summer and I both were really, and the whole team, really trying to drive us towards something actionable today. So if it felt rushed getting to this point, I apologize, but I think we're going to be able to get some concrete work done that will really launch us into what we can do next time when we reconvene. But I did want to mention the parking lot that we have up, and this is just a facilitation hack. I'm trying to make sure when ideas that are really important, but maybe not so focused on what we're here to do today, we can put them up there so that they're not forgotten. We can revisit it to the extent in which we can, and just make sure that people feel like the things that need to be addressed somehow get there. So we'll be using that over and over and over again.
If there's anything that you feel like we haven't caught, or it just strikes you but you don't want to interrupt the conversation, that's what all the sticky pads are that were on the table in front of you, is just jot it down and, you know, stick it on the parking lot later, hand it to one of us, something like that, just so that you don't lose an idea if it's something that's important.
Well, yeah, and thanks, Jill, for reminding me about that, because it's also a way, if you just kind of are more comfortable sharing that way, we're certainly open to that. And we're going to take all this back and try to incorporate it into how we form when we're together again. All right. So the vision for the behavioral health task force. We met as a Farley Center team. We met with Summer, trying to come up with a starting point for what are we trying to do. And the first draft of it, Summer's eyes were like, what? Like this, we got to chop it up. So she's been great to work with and trying to get us to a place where these feel like it's more in manageable bites. But I am going to take a second just to read it out loud. A comprehensive behavioral health system that meets the behavioral health needs of all Coloradans in the right place at the right time to achieve equitable behavioral health outcomes. So it's kind of big, it's kind of lofty. And then we put kind of these bullets below it about putting the consumer at the center, coordinating with criminal justice, human services, health, education, providing a continuum of care, of promotion, prevention, and treatment across the lifespan, integration, culturally and linguistically specific services that are financially sustainable. So these are kind of what things we would need to do to make the vision move or to accomplish the vision. So this was a stab that we feel pretty good about. We were able to go with Summer to Fort Collins to listen to the community group there and kind of pick up on some of the things that were resonating and bubbling up. These are similar things that we've experienced in other states when we've done this work, but we want to give this task force an opportunity to own this. And that's what we're going to work on in small groups in a minute, to really ask yourselves questions like, do I see myself in the vision? Do I see my organization represented here? Is this why I thought I showed up this morning? Or was it just for Panera? Like, what do you? Are these the right priorities that the task force really wants to tackle? And we're going to ask you to each multi-vote on this at the end of the next break, to really think about prioritizing and adding or slashing some of these things away, so that we can get a sense as those who are kind of trying to steer the process, that we understand the priorities of the task force, that we can make sure we're focused on that in the work that we're going to ask you all to do together. So anyone, Summer, Shale, Jonathan, want to add to my explanation of how we kind of got to this point? No?
I think the important thing is just that this is a starting place. It's not to say, here's your vision, now figure out how to do it. It's more that this is some language to start with a vision statement for this task force. And in the next, not enough time, but 35, 40 minutes, we're going to try to tackle it, see if we need to shape it. What do you guys think you're okay with? What do you think is left out? Those sorts of things. So that we can try to feel like, yeah, we're coming together and around what this vision should be. It's not to say that it could never change, but we want it to be fairly close. Yeah.
I think it's interesting how we define a behavioral health system. I mean, starting with there, right? Because we haven't gone anywhere with the traditional definition of a behavioral health system. So if we're moving upstream and we're focusing in on how healthcare is delivered and how we assess things earlier and how we support right time access, that isn't your traditional behavioral health system. And so I just encourage us from day one, and that's today, to be thoughtful of how we define the scope and goals of this work, because we have pretty much defined it as a behavioral health system given who's around that table. And so we just need to be thoughtful.
Yeah, absolutely.
If the revolution starts today.
Well, I think those are
kind of like to just add to that as well. We've, like I said, in the state in the last few years, we've done a lot of work about treating the whole person. So I don't know if you can siphon off behavioral health and just overall health. And somehow or other, I think we need to reflect that.
Yeah, absolutely. Yeah.
I'd like to challenge us to look at the entirety of the ecosystem of healthcare and the accountability of various parties within the ecosystem to spread the wealth. So that in the same way we had a primary care bill that said what amount of dollars to spend on this. We have a lot of providing services that may or may not choose to be in this area. They may or may not have a tax exempt status. And the definition of what it means to have a tax exempt status. And what do we hold folks with a tax exempt status to do? Maybe I'll just, we need a significant part of those dollars to go towards this. We as a society say, this is important. So there's an accountability of stakeholders in the healthcare continuum to understand their obligations to be health. I don't see that. What I see is financial accountability or financial
Well, and we're going to have a whole other session today to really dive into accountability. And
so there's a delivery system time potentially. What's an understanding of the accountability?
Yes.
Of these players in the system. How do we measure that, include that in the outcomes of this big work stream?
Yeah, that's reassuring. It looks like we're going down the same direction. What I'd like for you to do, I'm passing around a worksheet. And just to use our adult gathering skills to move into small working groups. Summer and I would love to ask the executive committee to spread out and join the different groups so that you're not a group of yourself. And we're going to spend some time really answering some of these questions. So we have about half an hour, and I'm going to go through and ask you to think about these first four in your groups first. And then I'm going to switch gears on you in about 15 minutes to kind of look at the last two. But can you see yourself and know what's missing? Are there elements in the vision statement that do not reflect what you're here to do? And are there ways that you would rephrase to simplify the message? Because we're really trying to get this into a little elevator speech. And things like what Kim is saying around accountability, like what is the language that needs to be here to hit the mark? And then in 15 minutes, I'm going to switch you to questions 5 and 6 about trying to think about prioritizing. Are there additional vital elements, which are those underlying pieces of underneath the vision as it stands now? Think about how can we prioritize this as we tackle them. So this might be the most challenging task of the day. It's just getting into the small groups.
How many do you want?
How about we do like five groups and maybe just like one. And we're going to ask you to redistribute later on tonight. And the members of the public, join the conversation, please. We want to hear your perspectives, and we're glad you're here. 3, 4, group 4, and group 5. Okay?
And I think those two overarching comments were really important as we think about whole person health, as we think about breaking up or redefining a system. How do we want to talk about that? And build that into your conversation.
Yeah, and if each group could kind of identify a recorder.
Maybe tables and like.
Report back out to the group.
Okay, that's great.
But did you guys get to see them? Because what kind of group are you when you didn't get to be part of it?
Okay,
My gosh.
So when I think of a behavioral health system, I think of behavioral health providers, community mental health centers, those sorts of things. When we're talking about our unit, it's not that. It's as a comprehensive behavior.
Hey, Corey, can you hear me?
I can hear you. Can you hear me?
Yes. It doesn't look like I assigned just randomly people into groups, and it doesn't look like anyone else has joined your group. So I'm going to attempt to move you into another group.
Okay.
And I apologize for our some of our tech difficulties, but just hold on one second.
All right. Thank you.
I don't even know if I can see it. So I've got my vision up here, this draft vision statement of of that slide they had posted several minutes ago. Okay. Let's see. So it looks like our discussion is supposed to focus on, do we see ourselves in this work of that vision statement? And if not, what's missing? I still can't see the vision statement. So they sent it just like right before the meeting. They sent 2 documents, and one was this vision statement. So that's what I'm looking at. Okay. So unfortunately, I don't have access to it. I think I saw a slide show up when at one point in time, but I can't get back to it. I know in other meetings they've had like the documents somewhere that you could pull them up, but I don't see that here. Right.
Hi, everyone. This is Emma from the Farley Center. Thanks for your patience with us. Some of the documents were emailed ahead of the meeting, but if you did not receive them, if you want to quickly put your email address into the chat, I can make sure you get those.
Okay. Let's see. Well, the chat. Okay. So my email is. Let's see. Oops. Oops. I can type. IR. Is that right? Yeah, that's right.
Great, thank you very much. So I believe we have about 20 minutes to talk through these questions. I just want to, I don't know if my message came through, but remind within your group, if you can identify someone to take some notes that can be sent back in, as well as someone to report out for the group. Stephanie will hop on to Zoom to make sure that our Zoom participants also have a chance to weigh into the group discussion.
Okay.
I am going to hop over to the other Zoom breakout group, but you can either send me a message or I'll check back in with you all in a few minutes.
Okay.
Thanks.
So I just need to see if I can see if they sent a message to my email. Let's see. Ugh. I'll get back to my email. Corey, do you have the vision statement?
somehow. You know, a comprehensive network that addresses social determinants of health in meeting the behavioral health needs of all Coloradans, something like that. I would also restructure the vital elements. I would put them in a different order because I think that consumer at the center is perfect at the top, but then putting criminal justice systems and human services right after that, I would put providing a continuum of care across the lifespan, and then providing services that are culturally linguistically specific. I think I would put those closer to the consumer.
I would agree with that. I think I would like to see coordinate the criminal justice system, that piece toward the bottom, perhaps even have services, because I think it makes more linear continuum of care sense. You're absolutely right.
Yeah, I'm going to reorganize that. I'm kind of taking notes. I pulled down the document and I've got it as a Word file here. I'm just kind of making notes as we go.
Yep.
Hi, everyone. This is Emma from the Farley Center. I'm sorry to interrupt your discussion. I just wanted to see that, to see if you had the worksheets. I know a few people received them by email. If you did not receive them by email, you can send your email address in the chat and I will make sure to get those to you. And also just wanted to remind the group to identify a recorder and then someone to report out when Stephanie runs the room. She'll be asking the Zoom groups to report out as well.
Okay, thank you.
Great, thanks.
And it's Della, right?
It is.
Yeah, I just sent you a message. I thought it'd be easier for me just to write it and send it over to you, kind of with my changes in that vision statement.
Oh, nice. Comprehensive behavioral health system that addresses social determinants of health needs of all Coloradans. Perfect.
I do like though the network. There's something about that word, and maybe instead of system, network.
That's exactly what I was just thinking. A comprehensive behavioral health network.
Yeah.
I'm going to copy that and throw that in. A comprehensive behavioral health network that addresses the social determinants of health needs of all Coloradans in the right place at the right time to achieve patient-centered behavioral health outcomes. All right. We got it. So what about, let's see, I'm going to cut and paste this here. Are there elements within the statement that do not reflect the work of the task force from your perspective?
I don't think so. This seems like such a huge task force, obviously tackling an issue that I don't know that I would take anything out or something isn't appropriately there.
Yeah, no, I think there's broad representation. Are there ways that you would rephrase the statement to simplify the message? I think we kind of didn't necessarily simplify it, but I think we clarified it. Additional vital elements and how you would prioritize. So we prioritize them by, let me copy this. I'm going to show you what I've got here. Okay. Let me see if it all came out. All right, I sent you the way that I reorganized the list.
Yep. Yeah, I like that. That flows a little bit better, a lot better actually.
Yeah, I think it does too. should we say something specific about workforce development if we're going to add that in as a vital element? I would almost say that across the spectrum that the system proposes to address, even in the areas of prevention. We need workforce development at all levels. So maybe just that. Increased number of facilities. Are you thinking of specific facilities, or are you thinking of a variety of facilities?
I'm thinking about a variety. You know, everything from we lack in substance abuse beds, inpatient beds, psychiatric beds, child and family beds. I mean, it's across the board. Very, very light when it comes to those significant.
Okay, I'm going to add these things into our vital elements. Workforce development at all levels, increased number and variety of facilities, reimbursements for non-traditional service delivery mechanisms.
You know, the word that comes to mind that I'd like to use would be something like modernize behavioral health reimbursement.
Okay.
You know, something along those lines, because there's been such a shift in the medical world to get a little bit more up to speed, and I don't think we've done that with behavioral health.
Right.
And reimbursement doesn't always mean just pay more money or pay more money out. It's just make it more efficient, make it more effective. So modernize is that comes to mind to me.
Okay, modernized behavioral health reimbursement. All right, I'm going to add those to the list like this. And then I'll send it back. All right. What do you think?
Yeah, I mean, that, it's hard to say this, but it looks more robust and more complete than the previous version was. So.
Okay. All right, I'm going to add those in. Put these down here. Great. I think we answered all our questions.
I think we did. Well, it's got to be easier with 2 people than 25.
Right. I guess everybody else that called in was an audience member.
This is Amber. I'm sorry. I had to disconnect my phone to take an important call that was coming through, and I was joining Zoom by phone, and so I had to be on this meeting, but then use my audio through my phone to make that call.
Oh, okay.
Yeah, so I apologize, guys.
No,
I
you're
wasn't
good.
able to contribute.
I'm sorry.
All interesting things I was listening in on, though.
Did you have anything that you wanted to add, Amber?
No, what you guys said, spot on.
Great.
Words out of my mouth.
So, remind me where you guys are from again.
So this is Amber with Centura Health, the St. Anthony North Emergency Department initiated medication assisted treatment program. So St. Anthony North and University were awarded an OBH STR grant, the State Targeted Response Grant to expand treatment of opioid use disorder. So we're in our emergency department starting people on the medication.
But I guess my thought was that, and again, not ignoring the financial piece, because I mean, my background, actually, I have an MBA in finance. I did corporate finance for a long time before I went back to medical school. So I know that cannot be ignored, but if there was some way to partially ignore it and think in the best of world, if we had every, money wasn't an object, what would the system look like? And then part back based on, okay, we don't have all the money in the world, you know, what, you know, can we come up with additional sources of income, or what else can we do?
To the Zoom breakout group, we have about a 4-minute warning before we'll pull you back into the full group.
Okay, thank you.
Oh, we have 6 questions. Ooh. Only got the 3. Rephrase to something to simplify the message.
Stay on top of what everybody's doing in the region and hopefully get somebody on board who can do some good coordination work among all those entities so we can better work together and identify what gaps we still have.
That's important. Yeah, definitely. And it does take that facilitator or that coordinator to help identify what those gaps are.
Yeah, it really does.
I'm going to just quickly interrupting your conversation to let you know there's about 2 to 3 minutes before Stephanie will pull you back into the main group.
All right, great.
Thank you.
So how about you, Raul?
So I'm in Grand Junction. I'm a psychologist here. I wear multiple hats like most of us do on this call. But primarily what I've been doing the last 5 or so years has been providing consultation to medical practices, medical systems for the integration of behavioral health in primary care settings mostly. I also work with clinicians to help them be more efficient in our limited resource area. We like to work in silos, which doesn't really help with this whole network thing that we were talking about. So just doing a lot of cross-training and bringing people together, because we have, I don't know, probably somewhere between 36 to 48 clinicians to serve 100,000 people. So, you know, it's a little difficult.
Yeah.
But I also serve as a secretary for Mental Health Colorado, and have now begun working with the VA to improve some of their community care options, as that system is going through a whole lot of changes with regard to access for veterans and communities rather than necessarily at a medical facility. So.
Oh, nice.
Keeping busy, that's for sure.
Boy, aren't we all?
Yep.
What's the temperature in Grand Junction today?
It's only about 90 something, I think.
Okay, only. Yeah.
We're still freezing at night down here in the San Luis Valley.
I was driving back home last weekend, actually, last Sunday from Denver over, and we drove through some snow. So I definitely know that you guys are
Right?
yeah. Stella, do you want to speak on our behalf?
Sure, yeah, I've got the notes right here, so.
Okay, are we all together? Pretty much? All right, I'm doing student camp. If you can hear me, clap once. Okay, I'm not going to do if you cannot hear me. Okay, good. We're all good. So thank you all for what is obviously like what we're going to get to here, is to really talk and share and really understand each other and make this work happen. I think with the liveliness of the conversation that's been happening and with the importance of this, to me right now, this is like the most valuable moment, is to hear what you guys had to say about this and to try to figure out where we need to make modifications and how we can begin to bring these good ideas together to make this work. So what I'm going to ask is a couple of things. We're going to have you guys report out briefly and just tell us what you did. Did you work on the vision statement specifically? Did you think about these 6 components of prioritizing what kinds of actions we would need to take to be able to implement a vision statement? Just let us know first what you did. You tell me what you think was the most important thing that came out of this. And in particular, if there are specific things that you think we're missing that you would prioritize, this is really where I think the work needs to start. Make sure that we get that, that you verbalize that so that we capture it. Let me stop there and then we'll do a little orientation. We do have 2 more virtual groups that worked from the ether wherever they are. And so we're going to bring them into this conversation too. But I'm going to start right here with this. I don't know what team any number was. Let's start here and please. So, Sharon.
So I'll try and project my voice so everybody can hear.
Maybe stand, that would help a little, if you don't mind.
No, I'll stand.
Just know this is your mic.
So I just have to say, you guys, I have a equivalent of a pacemaker for my brain, and it affects my voice. So sometimes if you can't hear me, like it went off just now because I told you that. So I apologize ahead of time. But essentially, I think we did a little bit of everything. The point that the group jumped in, that we really, I think, what focused on the most is that first part of the vision that says a comprehensive behavioral health system. I think we felt that sounded too much like pointing to one entity, like there's just this system out there and not having all the different components or players in that. So you can't just point to the state. So it is the educational systems, human services, public health, it's all of that. So we were looking at, without trying to wordsmith, talking more about kind of a continuum of services. There were also some on the group, but when we try to reflect everyone's opinion that wanted to make sure it was kind of a holistic approach, that when people hear comprehensive services, it's kind of some of the language that we all hear and that we need to be transformational in how we look at this. So I think that was the biggest point that we talked about without getting into the wordsmithing. Some of the little offshoots that we talked about is making sure that sustainable housing, when we talked about the different coordinates, the different services, criminal justice, et cetera, housing and sustainable housing was a big component of that. as well as workforce. And we talked about it both from the workforce in terms of providers, as well as workforce in terms of people who are in need of services. So here comes the real wordsmithing for you. We didn't like the order that those went in terms of listing criminal justice first. We felt it should be looking at it from kind of more of the preventative perspective. So looking at, I think we talked about health and education, then human services, and then criminal justice services. It might be minor, but just to kind of shift that focus. What did I miss, you guys?
Exceptional job. Excellent. Thank you, Debbie. For wordsmithing, if someone has come up with, and I think it may have happened around the room, a different wording for either the vision or any of the components, will you please write it and hand it to me? Or put it on a sticky? We're capturing it, but I want to make sure that we really get it right.
I'm trying to dance between the laptop and the sticky notes to try to.
Yeah, so that's why, you know, whatever you've written, you guys, yeah, if you want to just write it on something in the sequence, that one I think I've got in my head, but by the time we get to the end, I'll probably lose it. Okay, next.
Here, so we came up with our name because we heard somebody say it today, responsible disruption. So we are the responsible disruptors. I like that. Although we kind of came up with a lot of the same things that Debbie talked about in their group, we thought the definition was kind of old. That it's old. Kind of looks at what has been, what is. And if we're going to really be life changers and transformational, we need to come up with a new definition. And we wondered if today was the day that we had to do that, because it's really important. I mean, this is really important foundational kinds of stuff. So some of the things that we didn't like the word behavioral health system, because that only focuses on one part of the human being. We wanted it to focus more on the whole person. Not because we think behavioral and physical health are very well connected. So we didn't like that. We didn't even understand what the word system meant. What does the word system mean? And we needed a definition that that's going to stay in the definition. We thought that behavioral health impacts more than just the person. It impacts their family, or their support system. It impacts the community. And so we thought it should be address all those, all those pieces. So we also felt that it looked at sick care as opposed to wellness, and we would like more focus on how to keep people out of the system in the first place. And if we think about our own lives and what keeps us healthy, both physically and mentally, it's things that Debbie was talking about. You know, you have a job, you have a support system, you have a house, you have food, you have things that refresh your soul, you exercise, you do things to go to the mountains and, that kind of thing. So this is more of a focus on sick, and we'd like more of a focus on well and keeping people well. We liked the fact that it was consumer-centric. We felt like the services were more than criminal justice, more than human services, more than health and education. It's housing, it's work, it's employment, it's workforce, it's food, it's all those things. So we felt like that was sort of a myopic kind of a look at things. And we felt like peer support might be missing as well. Sometimes, we talked about how some days on a continuum of 1 to 10, we're 3s. Sometimes we're 10s, and when we're 10s and we are healthy, we need to figure out, giving back. I don't know where that fits in the definition, but we thought that was, really important. And we talked about in physical health, how, say, for example, someone goes to a doctor and they get a prescription, and the prescription's supposed to be refrigerated, and the person doesn't have a place and doesn't have a refrigerator, so how do they stay physically well if they can't refrigerate it? So could we at some point in time move to a more creative system where, in addition to the refrigerator, or in addition to the prescription, the doc can write a prescription for a refrigerator so that the person can keep their medicine.
And also healthy food to put in that refrigerator.
Exactly. So we felt like this was a little bit myopic, and we didn't know if we needed to come up with a definition today. But if we don't have to come up with today a definition, maybe we should put some more thought in this. and be a little bit more holistic like the other group indicated too. And Representative Landgraf talked about, what was the phrase you just used, Representative Landgraf?
Life system.
A life system. So that would kind of a birth to death kind of a thing. And I know we have a person over there, a family member who, Betty, who talked about what happens to people when their parents are gone and they can't take care of them anymore. So it's more of a life system.
Life system.
Life system. Yeah.
So that was our responsible disruptors over here. Oh, and then we also heard that from Doyle that under the Obama administration, the Surgeon General came out with a report about how to keep people well in terms of behavioral health, and we thought maybe we should get a hold of that also and look at it. Maybe incorporate some of the elements of that, what we do in Colorado to be the trailblazers.
Excellent, thank you. I think with respect to, do we have to come up with a definition? Do we have to come up with a final solution today? No. This is an entry point into this conversation, and I couldn't agree more that this is fundamental. This is foundational, and I even think that, while we want to get close, and this is what this whole discussion is about, there may be, we still may need to sort of shape and tweak along the way, right? This isn't like, oh, we got it right. So that's useful just to think about that. And the collection of this information will be to reformulate and bring it back and send it back out and let you guys continue to push and shape. Okay. Do you want to try a Zoom group? Yeah.
Let's do a Zoom group. I'm going to ask the Zoom folks to be proactive here because we can't see who is in each one. I know there were two. So if the two reporters from the Zoom groups can unmute themselves and let us know that you're with us.
This is Della. I was part of the Zoom group, and I hope you can hear me.
We can hear you. You're making Della.
So I sent via chat the wordsmithing that our group did with regards to the vision statement. A lot of what's already been said about making it more holistic and not just behavioral health, given the list of vital elements. So our new statement says, a comprehensive behavioral health network that addresses the social determinants of health needs of all Coloradans in the right place at the right time to achieve patient-centered behavioral health outcomes. So we included network in there, and then we also felt that the social determinants of health language was important because we're looking at upstream activities and those vital elements, as well as treatment. And then what we did was we went back to those vital elements and we reorganized them and we added 3 more. So we felt that putting the consumer at the center was definitely should be at the top of the list. And then the statement that provides a continuum of care from health promotion and prevention, we put that one second. And then the third one we put provides the services in a culturally and linguistic specific manner. And then integrate services was our next one. Increases the number and variety of facilities was something that we added in for ourselves. And it's facilities across the spectrum of service delivery. Modernizes behavioral health reimbursement. We discussed how behavioral health reimbursement really hasn't kept pace with some of the reimbursement changes that have happened on the medical side of things. And we really need to look at how we're going to be reimbursing these services across the spectrum. And then financially sustainable was our next one, and the coordinates criminal justice systems, human services, health and education. we put next. And then we also discussed workforce development and how that also needed to occur at all levels. Whether you're talking about early intervention and preschool settings for prevention, or you're talking about more treatment beds in an inpatient facility, we need workforce development at all those levels. So we added that one at the end of the list. So now we've got 9 vital elements.
Great. Della, could you do me a favor and type those into the chat as well? Your priority list. I tried to capture as you were going, but I'm not sure I got it.
I will.
Yes.
Okay, let me just copy and paste.
For those in the room, you can see Della's revised statement on the chat.
Great. All right, thanks, Della. Can I come to the group up front?
Yeah, sure. So we considered all the systems that people have been talking about in the room and came up with somebody revised a beautifully succinct statement, a Colorado that meets the behavioral health needs at the right place and the right time. So taking into consideration all the systems within Colorado that are impacting the behavioral health needs of people. So that was our revision. And again, just taking into consideration all the different systems that people have been talking about in the room. And then we did reorganize and prioritize the vital elements and added a couple words, but we saw the consumer and the 5th one, providing services in a culturally and linguistic specific manner, to be one. We saw the 2nd priority of bringing the 3rd and 4th together. So a continuum of care that includes integrated services. And then the 3rd would be this 2nd one. And then a 4th would be the 6th one, financial sustainability, along with quality and accountability.
I love it. We've always got lumpers and splitters, right? So you guys figured out ways that they come together and ways to pull the priorities together. And then others have said, but we want to make sure that we call out this specific element. So just different ways that we all think about this, but to try to be comprehensive.
And then one of the other things we talked about, I don't know how we fit these in there, but like having flexibility around the unknowns that'll like what we don't know right now that might come up in a couple months, and having some flexibility and building those in. You know, what is their subjective success of like what are successful outcomes for someone, what might be successful for one person receiving services might be different from another, and then trying to maintain some simplicity and streamlining in the work that we're doing. So, did I capture everything?
Good job.
Nice. Okay, so we're more than halfway there. We have 3 more groups to report out, and then let me just tell you what we're going to do next. Then we're going to take a little break, but during the break, we're going to have you guys vote on the 3 things that you think are priorities. Now, the way that you've lumped and split also works. We're just trying to get a sense of whether we've captured everything, and if there are some things that people are like, far and away, this is the most important thing that we need to really drill down on and make sure we get this right. We'll do just a little voting to see if that helps to prioritize these components underneath. Yes.
And Summer, my understanding is that we just want the voting members of the task force to participate in the multi-vote. Is that correct?
I think so.
Yeah.
Yeah.
So what I'm going to do when we break is I have 3 stickers apiece for those of you that are voting members to come up to the front, take your 3, and that's how we'll do the multi-vote.
Sound fair? Is that making sense? Okay, let's go back to our Zoom. And do we have one more Zoom group to report out? You check on them, and you guys up?
My notes here, if I can read them.
Excellent.
Our conversation revolved a lot around community, the concept of communities. We felt like, standing up so our conversation revolved a lot around community, and we felt like the draft vision statement as it reads now isn't really necessarily possible everywhere and in every community. Well, it's a really strong statement in a traditional sense. It does need to be broader, so echoing some of the other talks in the room. It needs to talk about community and how all roads lead to health. Must be about the whole person and family, wraparound services included. We felt like behavioral health, that term was in there too much. Maybe could just be in there one time and refer to things more as health, if even that. And we talked about how do we promote thoughtful cultural change throughout the state. With access that's all encompassing, we threw out words like connections, preventative, infrastructure, maybe rather than system, to create solutions. Improved access, support and recovery, improving resiliency. We talked about the idea of upstream, working upstream. The idea of culture and diversity didn't seem prevalent in the statement, so we talked about that. And some of the groups that we weren't sure were represented as clearly as others, for example, the older adult population. So just the need to maybe pivot the statement a bit and break out of kind of the either or thinking when we talk about preventative health, behavioral health care, the fact that there's not a safety net necessarily, and also the need for a clear consumer voice. So a draft revision might say something like changing the whole person outcomes in our communities by moving upstream, advancing right time, right place access, and transforming the way individuals, families, and communities are supported. Wow. I didn't write, well, actually, I did write that now.
Ask you that if you can turn your worksheets in to us, then we can capture your work and your words, and we can start to kind of push them together.
Yeah, especially these rewritten statements, the regrouped sections, those sorts of things we need to, if you can give them to us, then we're less likely to have mixed them up and gotten them wrong. Excellent. Thank you. Okay. Now, are we ready here? Should we go here?
I'm not getting, you can ask again. I didn't get them. Yes, not sure if you could hear me. We're looking for Corey Notice Stein.
Corey, you want to try one more time? All right, Corey.
How about now?
Here you go. We got you.
Yeah, there we go. So, going towards the end, it's always easy because we like everything that you guys are saying. So that makes it helpful to follow up. I think we could reiterate a lot of things, but what I'd probably say is maybe the things that we talked about that weren't directly stated or maybe understated by previous groups. And a lot of our focus was turned to those vital elements and looking at incentivizing insurance providers in order to increase reimbursement rates, specifically around parity in licensure types that serve our mental health community, especially in our rural communities, where we might be lacking certain types of licensed individuals that provide mental health care. That probably feeds into a lot of people's conversation about the workforce development and lack of current providers in communities outside the major metropolitan areas. And if we're being really honest, if we're really aspiration, we're going to see a huge driving need, not just in our rural communities, but also in our most urban settings as well. I think many people touched on this in addition to the statement, and we really didn't spend a lot of time wordsmithing the vision statement, but if we're thinking about being aspirational and driving change into a new environment, behavioral health and the people's prior adjustments are spot on. And I think we need to continue to focus on those early interventions and wellness as a whole. Someone that comes from a non-provider location, I would just say this: when we use the terms consumers and patients, it feels less humanistic. And so I think we might want to look at how we use language that feels comfortable for those that are seeking our support, and being mindful of that language that we're using that seems more transparent and open for all and not restrictive just to the behavioral health community.
Excellent. I think that really resonates with some of the conversation that we had a little earlier about really understanding the language that we're using, and and how we really want to revisit that and think about all of us adopting and using the same language as we speak about the people and the populations that we're trying to assist. And it's really all of us in that community. Okay, are we at one more? Okay. Yeah.
So yeah, also to not try to restate what's already been said, I just think we need to focus on some definitions throughout to make sure that we're all on the same page with what we're talking about, whether it's what does culturally and linguistically specific mean versus competent or informed, or the different ways that we have this. And so we need to be specific, because we quickly recognized we were thinking about different things when we said something like the behavioral health system. Also thinking, while I'm there on culturally and linguistically, adding trauma informed in acknowledging the importance that we now very clearly see from the research on the role that trauma plays in somebody's mental health and all sorts of other health outcomes over the course of their life. The other really important thing was something, it kind of goes to some of the accountability comments made earlier, but that we need to acknowledge we're not going to build a perfect plan and it's going to just be executed just right on the first try. We need to have something in here around a shared commitment to continuous quality improvement and evaluation. Is it working? What's working? What's not? All right, let's iterate. Let's continue to get better on it.
Do you work at the Department of Family Medicine?
No, I work with
No, I'm
the
just
Wise
asking.
Public Health.
I'm glad someone said that about how are you going to measure it, because that's always the first thing that comes up in our meetings. Like, how are you going to measure it? What are you going to know?
That's it, exactly. And then the kind of biggest thing that we felt was lacking is something around the fact that we need to be designing solutions locally, systems that are controlled locally. And when you do that, and when you're committed to continuous quality improvement, you get to a place where we're not doing as much finger pointing and blaming. We're owning the problems together. We're designing the solutions together. And then if they fail, okay, let's go back to the drawing board and let's figure it out and do it differently. Build on. We had a good amount of rural folks. We started talking about, it's very easy to design these sort of, here's the solution that's going to work. It eventually trickles down in the form of whatever funding stream or something like that. And it gets to the community it's supposed to help. And we're like, what the hell is this going to do? This is not what we needed right now. So that goes to kind of the last piece, which is tied to financial sustainability. But really, when you think about rules, regulations, funding streams, they need to be simplified. They need to be sensible. They need to be flexible so that we can really tailor the approaches unique to the needs and resources of each of the different communities in the state. And when they're not, then you get to what, I don't know how many people have seen the kaleidoscope thing we have, a not very big pie in the first place, sliced into 65 different funding streams across 8 different state agencies with different outcomes, metrics, whatever tied to them. And by the time it gets to the community it's supposed to help, they're like, this is more administrative overhead than it's even worth. So put that in this.
Put that in there.
Add the pie chart. Yes.
All right. Part of this will be, if for some reason you don't have this in a worksheet or your handwriting, we can't read, some of this can come back in the survey that we do between meetings as well. And as you're ruminating on this on the drive home and language to include and what was not there, we really, really want to hear it.
So the challenge that I think, what we just put forward is we've got some brilliant expertise in the room, both from all the work that you do and just your lived experience. And trying to capture that in a single overarching statement is hard. What we want to do over the course of the next many months is not craft a statement. It's really figure out how to do it, right? And be able to tie it to recommendations, but understanding them from the community and local level. And, this is gonna get even trickier than, this conversation where we can all talk at this level about what this should be. But you've given great insight, great input, and now we will reshape a little bit and feed it back and see if we can get things that are a little bit closer. Some of the really interesting things that I think came up to me are just how whole people want to be and realize that behavioral health is not this peripheral aspect of something that should just be considered separately from anything else. So how to be able to integrate that into the families, the communities, the business, the financing, so that it can be understood as part of the whole, is quite frankly, work that has been in some ways known, but not acted upon for decades. So this is the revolutionary piece. This is the how do you take the word system out of it completely and just say, this is what we do for people. So thank you. This is a great start. Let's take a little break. Let's just do a 10-minute break. My question for you guys, Farley folks, is do you have the items up there for now?
Well, I think so.
Try
I was trying to capture when we came up with more of what we were calling vital elements, so the things that are shaded below the vision statement. So I added, in addition to what I have here, we added workforce, which is so broad.
Yeah.
But workforce addresses social determinants of health. I kind of lumped that into a lot of things I was hearing about housing and food and transport and school and then I'm not sure if modernizing reimbursement is different from financially sustainable. Do we think those are two different things? Yes.
They're related.
Yes, they're kind of related.
Related.
Okay. And then did I miss any that were addition to the mix there?
I think this last group really brought up a important point about administratively facile, because administration costs a lot of money. I think that falls under the financially sustainable or modernizing, because the amount of time people spend in local agencies doing administration and the amount that costs could have a terrible impact on our capacity to be financially sustainable.
And I think local solutions is another critical piece that is a little different. So what I would say, local solutions.
Okay.
So what we're going to ask you to do for you all who are voting members of the task force, for what it's worth, we'd like you to take 3 stickies and vote on the 3 things that really rise to your highest priority level. Okay. We'll see what that tells us. All right, just to get started. We'll do that during the break. We're going to take 10 minutes. We'll come back at 3:15. We are going to finish right on time at 4 o'clock. So we still got some topics and work to do on accountability.
You really messed this room up.
I know.
Junction. So have you gone to our one source yet?
I saw
Go in and tour. Not turn anyone away. You're not a veteran, you're a spouse. The hustle doesn't have to get so they send them to us. Right now, the first tenant we have is Vultures for America. And so we want tenants who can serve the advisory board. And it's all locals. So it's run Western slope, but it's run not anybody. Makes the difference.
now? Exercise my voting rights.
Hey, boss, where you at?
Right now? Yeah.
Right now. Well, they lost.
Or Hi, Nancy. Nice to meet you. I'm really good. Yeah.
Hi, can you guys hear me?
Yes.
Okay.
Yes.
I lost connectivity from the room for a few minutes, so I don't know if you were able to hear the instructions for the next small group activity.
No.
No.
Okay, so I believe they're moving into small group work around the accountability worksheet. So that was the second worksheet that was sent out earlier. And if you didn't get it, I'm happy to share it again. But the objective of this activity will be to start to understand how we can hold the Behavioral Health Task Force accountable for the work that we set out to do. Do you guys have that worksheet?
Yes.
Yes.
Yeah.
I'm going to pop over to the other breakout group and I'll be back in to check on you guys in a few minutes.
So like, providers expanding the licenses, whether it's telehealth.
Hi, everyone.
Hi, is that Amber?
This is Emma.
Oh, hi, Emma.
Hi. I had lost connectivity for a little bit, so I don't know if you were able to hear the full group instructions.
No.
No, we didn't hear anything at all.
Okay. The group is moving into the second small group activity, which is talking through the accountability worksheet. And so
okay, that's kind of what we thought.
Opportunity to talk more about what success will look like for the Behavioral Health Task Force and how we can hold ourselves accountable throughout the year of this work. Did you all receive that second worksheet? It should have been included in the email if you got the first one, and if not, I'm happy to send out right now.
Yeah, Raul and I were just discussing the 3 questions on the worksheet, but we're having trouble with it because we just got done talking about our vision statement. So measuring success and progress kind of feels like a difficult task at this stage. Did you guys talk about that in the broader group before you broke out?
Well, I am also remote, and so I was not in the broader group. Let me quickly ping Stephanie and see if I can get some further instruction on that.
Okay.
Del, I think you're absolutely right, though, about the timeline will be one way that we measure and keep ourselves accountable.
You know, I think in terms of the second question about holding ourselves accountable to the work defined by the vision statement, you know, there was a lot of conversation about consideration of the person across the life spectrum, and not just cultural and linguistic specificity, but really working in a cultural and linguistically competent manner, I guess.
Yeah,
that's hard.
It is, and I don't even know where that's going to stack in terms of the priorities or how we ultimately address that.
I don't know either. I'm going to put, are we addressing the whole person across the life spectrum? I think that can sometimes also get to social determinants of health, but not necessarily specifically. And
mental health issues.
So do you see that one of the goals of the Behavioral Health Task Force is to look at and address housing instability, or what?
Definitely. That is probably the major complaint that our population has, is that where am I going to go live? You know, you talk about me following up at the mental health center, but I don't have a house. You know, that's not, your priority might be that I continue on these medications and continue with treatment, but my priority is getting a roof over my head.
So I'm going to say address housing instability with increased access to safe and stable housing.
Yep, sounds good.
All right.
How would it help? How would they hold themselves accountable to the work defined by their vision statement?
Hi, everyone. We have just a couple more minutes before Stephanie will pull us back together. And if you hadn't discussed the third question, if you can jump to that for a few thoughts on how we'll measure progress of the task force.
Okay.
Thanks.
I'm just gonna bring us back together so that we can actually get out by 4, right? Because that's our intention. Okay, I think that's pretty good. So let me just start as we finish, as you guys finish out the conversation by saying that this is clearly the beginning of a conversation. There's no way you can come to the solutions on this in this, matter of minutes. But we thought that it was really important to introduce this idea from the get-go so that we can be thinking about really how do we define this? If we don't define, it's again, not to be defined today, but it's got to be in our minds for all of us that are working on this. How are we going to hold ourselves accountable? What is it really, what is the purpose of this behavioral health task force, right? How will behavioral health task force define its own success? And so we're going to buzz through, just give us some top line ideas of some of the things that you thought were essential, because that's really what we've got time for at this point. And this was to just stimulate a conversation and to get you percolating on this a little further.
Yeah, because we only got the number 1.
That's good. Okay.
It's really good though.
It's really good. So that is that success for the task force is person and community driven. It's informed by what we're hearing from community stakeholders and the people that use services. And the systems and services can be navigated, and that I just threw in there because I didn't really hear it come up much today, but I still think we have a lot of focus we need to do on stigma. So I don't hear it come up. So I feel like we all act like it's not there. But something that I hear often is people talk about their family or friends that have behavioral health issues, but they have a hard time talking about it, maybe something that's affected them personally. So I still think there's a stigma that is gonna be a deterrent to this work.
So is it fair to say that that success, the behavioral health task force will be successful in addressing stigma?
Yeah.
Because again, and acknowledging and, certainly not ignoring it or making any presumptions.
Acting like it's just kind of like racism is gone. So is stigma, right?
Right. Yeah.
It might be more appropriate to call it discrimination than just stigma.
Okay. Okay. Meg, do you have that written down? All right. You guys go next.
We thought that success would be defined if we create a blueprint that includes easily defined actionable steps that incorporates acceptable language and has long and short-term issues, goals, something. That's as far as we got.
Okay.
We don't want a report that sits on a shelf.
Yeah. Nobody wants a report that sits on a shelf. I appreciate the idea, and I've heard it in others as well, of having a long-term vision and short-term goals, or even long-term goals, but that there's a direction that we're headed, and we know how to, that we're not going to stop. Iterative steps. Okay. Anything else that your team wants to add?
To talk about outcomes, like access improving by measurements, and that Colorado would be the place that people come to see how we're doing things, that overall rates of mental health and suicide and drug overdoses, we'll see bending the curve with those kinds of things as we move on. So we talked about at the end of wanting to actually see real things happen, not just have another report, but it's actually a blueprint that's actionable.
So I think that one of the things that was challenging with this was even just what was the point of what we were trying to do? Were we trying to figure out what are the outcomes that we should achieve with better behavioral health? Or what is the success of this behavioral health task force? And that's a bit of a difficult place to navigate, because if we're doing something right within the behavioral health task force, it should have some measurable effect on health of our populations, right? That's the whole point. Is there anything that you wanted to give me? so that I make sure I collect ideas and
Talk about
thoughts.
the legislative consent.
Thank you guys. Okay, team, you're up.
Good.
I said it, you didn't write it down.
Success for the Transformation Council is that it really is a genuine stakeholder process, sometimes not predetermined, but we are engaging here, and we are all owning a responsibility to go back to wherever our respective stakeholder groups part of the state are and serve as the liaison. And coming back, and we even talked about when it comes to measuring progress towards the goal, is there a way that we can actually create a real mechanism to go and say to whoever that end user is, did you notice anything happen as a result of this task force? Did it feel like a positive something occurred because we did all this work? And that's really where it matters the most. We can all pat ourselves on the back, but if they don't feel anything different, then probably it's fairly meaningless. Let's see. There's, I think, Anne, you're right on. There's a ton of public health indicators and different very specific metrics that we can draw from that likely exist already and we need to leverage. And we just need to get organized, and also understanding the difference between a proximal outcome and the distal outcome. And so we were speaking about how there's this tendency sometimes to expect very immediate results unreasonably for things that are going to take a generation to see turnaround. And that doesn't mean that we don't still invest in that generational effort. It just means we have to be patient and manage expectations from the beginning. We can't create the statewide crisis system and in a few years see suicide rates dramatically decrease. We hope fewer people died by suicide, but if we really want to impact that number, we also have to be thinking upstream on changes that truly are going to take probably decades to really see a difference in. So I think just going in, understanding, I think you already said it, kind of what's long-term, what's more immediate, and then managing that from the beginning.
Will I read that? Yeah. Okay.
All right. I think we had a similar issue in the sense of, are we talking about a short-term plan? So what would success look like at the end of the year with respect to this roadmap? But we all talked about data and the fact that we collect a lot of data about different metrics from different organizations. And so which data or which metrics would demonstrate to us that we've been successful? Is it reducing the suicide rate, which is, something that is not going to probably happen at the end of this year? So I guess we were thinking a little bit more shorter term, that we would create a roadmap that was de-siloed, so that we were working together and recommending a network kind of roadmap that was comprehensive, data-driven, and that we would know how to even make suggestions about how to use the data. And then what data should we be collecting and how similar should these pieces be? That data, and then people don't use the data. So again, thinking about how do we use and create a roadmap that could be an iterative process, using feedback from what we're recommending that we institute, but getting feedback from our activities in the years to come, and what those metrics will look like. I think we need to define at the end of this year, at least for now. And she wanted to ask, yes.
I don't know if I'm speaking for the whole group, but the part two is when we're looking at it from the system, coming up with those shared metrics that different systems aren't working against each other. Because I think a lot of times, depending on the outcome that's required or defined, you end up kind of pitting different systems against each other. Where if we came to an agreement around certain outcomes, everybody could be successful.
And ultimately, this is to benefit the individual in our community.
All right.
Sure, yeah. So this group talked a lot about if this task force is to be successful, then the blueprint that's created needs to not just be very comprehensive, everything from the regulations and the statutes to the cultural aspects, but it also needs to be very specific. When are we expecting change to happen? How are we expecting it to get implemented? Who is going to be implementing that change? But also beyond that process, to make sure that whatever this task force recommends, it's something that we can all agree to and also get very excited about, while still being realistic and something that we have a strong faith in that it will be impactful. If we put something out there that we don't believe is going to change the world, then why are we doing it? To get there, we talked a lot about just making sure that there's very specific assignments, both throughout the process and also in the recommendations themselves. And through that came up the theme of just having very specific expectations for engagement. How do we engage in this group, but also from the outside in? How do we get feedback from the outside? How do we bring it back? How do we take the work here out to our communities, get that feedback out there, and have a cyclical loop that process? And we also talked about measuring our progress by just making sure that we're not missing any opportunities to be successful. And that maybe a way we can do that is to just keep ourselves very accountable by just having some very thoughtful, proactive project planning. What are the timelines coming our way? What are the opportunities coming our way? And when do we need to be prepared to take action on certain things, whether that be the regulatory process, the legislative process, the budgetary process, or maybe even bigger systemic things. And then checking in with this group as we go along to make sure that we checked off that tally mark.
Anyone else want to add to it? Great. No, excellent. Thank you. Corey, are you with us?
I'm here.
All right.
So again, agree with a lot of people. I think we were looking a little bit more at the distal outcomes as we thought about this work, and some of the things we really focused in on were, having those tangible goals and measurable objectives, and really what happens for those consumers is that all their needs are being met in a timely fashion while at a reasonable cost. And as we think about what that would look like inside the system, we were talking about greater communication and sharing of data across agencies and systems, which tend to be barriers for collaborative processes. We also spoke to the idea that our criminal justice facilities and emergency rooms are not our leading providers for mental health, that we see that those systems become reduced in their overall delivery of mental health because they're seeking it elsewhere and having access to it in an earlier stage. We also spoke to the inequality that exists in our communities around resources. So those that were seeking support would have the ability to seek support in close proximity to where they live, and we're not having such long, exacerbated time frames for which people are waiting to seek services. And I think we were speaking in a much longer time frame because we recognize this needs to take some time, but really addressing the housing instability and increasing access to affordable housing. That's really also another barrier to seeking supports, are also a co-occurring issue with some of our families and community members that are experiencing mental health needs. And like everybody else, we started to define some of those measurable progress towards these goals. So those were the things that may be slightly different than those that were brought up.
Thank you. And Della?
No. Can you hear me now?
Yes, we can.
Okay, perfect. We, like everybody, we struggled to come up with very many concrete responses to these questions, but we really focused most of our conversation around the second question, holding ourselves accountable as a task force. And we didn't come up with answers, but we did come up with some additional questions. And those questions are we addressing the whole person across their life spectrum and within the social determinants of health impacting them? And how do we get at measuring that piece of the vision statement is really being upheld by the work that we're doing? The second piece was, how do we adequately address cultural and linguistic competence based on some of the earlier conversation that we had? And then how do we know that we're meeting the right time, right place directive in that vision statement? Especially given the broadness of the work as it's been defined. So we don't have answers to those, and we don't even necessarily have any process outcomes to start working on those. But those were really some of the key pieces that we felt that we needed to be able to hold ourselves accountable to. We just aren't sure how to measure that we're doing that.
Okay. Well, I think you're right. Those are the questions. And we'll continue to work on how we can really answer those questions. Some of what I heard here in terms of what would really make this task force, at the end of a year, if we can say, yeah, we can really sing this work, we will be looking at how we're collecting and using data to inform this vision, how we can begin to share across sectors, across agencies, across these systems to be able to unify that in a way that's not fragmented and siloed and behavioral health that's more peripheral. So the integration and the use of data, the feedback to the communities to be able to understand that it's not just something that we agreed upon within this room, but that it's actually getting to the people that we were trying to reach, and that they understand that there was some information that was what was being done here. I think the idea of being able to bring to one another events, programs, opportunities to share and function somewhat as ambassadors of this task force, to bring in all of the different perspectives and the programs and the work that you're doing so that we understand each other better, and then be able to share that back out. Those are actually some pretty definable measures that relate to the functioning of the task force itself, that would then lead us toward getting to that blueprint, which will then get to those outcomes that we're trying to drive. The success of the task force is not about changing ultimately, of course, it's for all of the patients at hand, but we're not going to be measuring suicide rates based on the meetings of the task force as much as our ability to come up with a vision that has short-term and long-term goals that can begin to address that. So that's how I'm pulling together some of what you guys just said, and then you can always tell me whether or not I'm getting it right. So I'm gonna let Stephanie wrap us up here. Thank you all for the work, for the sharing, for the ideas. Again, this is the part that's gonna make this work. And we just have to figure out how to be efficient and effective in the time that feels then very short for us.
So I just wanted to make sure, I think many of you who are here like representatives participated in the small groups and kind of sharing ideas. I wanted to make sure if there was anything else that anyone outside of the task force members wanted to share, that you had an opportunity to do that before we close. Which you okay. The next one. Yep, right there. We just wanted to quickly kind of. Oh yeah.
For the record, can you make a record of comments for us would be our legislative requirements? Sure. We're legally required to have public comments. We don't have any.
Thank you. Yep. So we will be circulating minutes. They'll be coming from CDHS. We'll have an opportunity for some additional contributions virtually. We can share the slides with everyone so that you have a copy. I think especially of those that Summer shared that really recap the readings, and there's a lot of good content there. We'll make sure you got that. Anything else, Summer, that you can think of that we want to send out?
No, I would just stress that a lot of what's being asked today will be a follow-up to the different conversations that we have this afternoon. So even though it's optional, please take the time to respond to it so we have that input and feedback for the next day. which, by the way, is August 7th. It's at the bottom of your agenda sheets. It's from 2:30 to 4:30 at the state capitol. There's a little bit of confusion. I think there was a invitation that went out this afternoon and then got canceled, so people are confused. So it is taking place August 7th from 2:30 to 4:30.
Will the dates of all the subcommittee meetings be posted on the website?
Yes, in fact, we've just gotten 2 of them scheduled in the last day or so. So yeah, we will have this probably all scheduled by end of the day tomorrow and on the website.
Will the agenda be posted prior to the meeting?
Yes, you got it.
And will our meetings be monthly and on a certain day of the month, and just so we can plan ahead?
Task force is meeting monthly, and so right now we've got August, we've got September scheduled as well. I will send that out this afternoon.
I think probably our goal, ideally, given that the subcommittees are meeting twice monthly, the task force itself is meeting once a month, is to have some standing, like it'll be the first Tuesday of each. I mean, we'd love to get to that and have them projected as far ahead as we can. I appreciate every single person who has tolerated the fact that we have hit the ground sprinting. We found out about this, the contracts were a go, and I mean, all this is happening in a matter of 3 weeks. I think Summer is officially over her first month of working on this. So we're really just trying to get these kickoff meetings accomplished so that we can get going and get started. So a little bit of tolerance of that calendar organization is going to take us, it's going to take us a month to kind of get there.
And how much are you all expecting us to attend the subcommittee meetings? Those are twice a month, and so that would be 6 meetings a month.
To the degree that you're available and want to attend, we would love to have you there. But your minimal requirement is these task force meetings and the work in between the task force meetings that we might give to you, like readings and so forth.
And the coaches of the subcommittees will all be attending the task force meetings, your meetings, and so will the Farley Center in Summer. And our part of our role is really to be a conduit for the work that's going between and moving us out. And so we will mechanism for that.
At least one of the co-chairs. I don't want to see Mayor Jackson heart attack here. For 3 times a month.
I plan them.
Okay,
But
great.
I do have some.
Yes, you can still be a human, participate in the process. But I think we're hopeful that the co-chairs will really be here, because I think a lot of the work of the task force is going to be kind of incorporating the work that they're doing on those 3 specific, really big topics. All right. We have, that clock is fast. How many minutes do we actually have? Okay. We were going to run the room and ask everybody to share 2 words to kind of just end on a high note. I don't know that we have time to do that because there's like 45 of you here, but do know that we appreciate your time. We feel like things are positive.
Does anybody want to share 2 words that they feel like captures today?
Yes. Go ahead.
Public communications team. So our first ask of you guys, among many that will probably be coming, since we're not going to do the round robin in the room, we ask this of the executive team, so please watch their video. It's a sample of what we're going to ask you to do. Please take a 10-second, I mean, I'm talking a super short video, giving us your clippable so we can shareable things there. You can either send them to Summer or you can send them to your representative.
The email up there.
Michelle, is there anything you want to say to close? Maybe we can put the pressure on you for your 2 words and then we can call it.
I'll get 2 quick words. Thank you. This was amazing. Such brain power in the room.
Guys, listen up, please. We're almost done.
Yeah, such brain power in the room. We didn't get to see the clip at the beginning, but one of the ways we're going to really try and keep this alive is we're going to be doing a lot of video mashups. So what Maddie's asking you for is a video that's going to be part of our promotion to get people to care about it. So please have some fun with it. Engage. You can reach out to any of us. We'll be hanging out for a little bit. And thank you, thank you, thank you. I really appreciate everyone's good thoughts.
And before you go, anything you need to turn in. So the forms that Summer asked you to sign, anything from the small workers, you want every piece of paper that you wrote on today. To stay here and you can part with it. Thank you.
Thank you, everybody. You rock.
Your words. See you later.
Go ahead.